Thank you all very much for being here, and I know it's an irregular time. No, keep chatting because traffic was really bad, and we were at the Be Our Guest event for the Silicon Valley Council of Nonprofits. So I know my colleague was right behind me making a dash, so hope we'll just say drive safely, and we'll start as soon as she arrives. Thank you, everyone. Do we have a representative from the Commission on the Status of Women here? No?
Yes,
Yes?
Marlene Zapata.
Okay, great. Thank you. Okay, good afternoon, everyone. Thank you so much for your patience. We were all coming back from a great event and ran into unexpected traffic. And I'm going to open the County of Santa Clara Children, Seniors, and Families Committee meeting. I'm going to ask for the roll to be called, and then we will begin.
Vice Chairperson Arenas.
Here.
Chairperson Chavez.
Here.
We have a quorum.
Thank you so much. We're now going to go to public comment. This is an opportunity to speak to an item not on the agenda, but within the purview of the committee. And so anybody who would like to speak in public comment, can you tell me how many speakers?
We have one request to speak online.
Great. Let's
Aye.
take that speaker.
iPhone 56, you'll have 3 minutes to speak. Timer will start when you begin speaking.
Yes, good afternoon. I wanted to remind you guys that already 3 children have died this year. In the last one, Jordan Walker was only reported on because his grandfather filed a lawsuit. So we don't know. There could be many more kids who have passed away due to the county's negligence after a report of child abuse or neglect has been made. Now, you all know that my kids are being sexually abused, and the county's not doing anything about it either. So there must be other children who are being sexually abused, and I know of other parents who I've spoken to who report the same thing that's happening to their kids, and the county is completely neglecting their well-being. Now, it's about time that we remove Daniel Little and Damian Wright and Wendy Kinnear Roush and even Sarah Duffy, who knows about the sexual abuse, from their positions. They're not competent enough to handle allegations of abuse. I think a prerequisite for doing a job like this is that you have empathy, that you care, that when you say a child has been abused, that it elicits and like icky, that reaction. That's so yucky. I can't believe it. That's icky. You're saying a child got anally raped beginning at age 13? That's icky. I don't like it. I'm going to do something about it. I'm going to get a screening for these kids. I'm going to protect them. I'm going to do something about it. But these people, they don't care. Who needs people like this? Children are the next, they're our future. They're every parent's pride and joy. They're the most important thing in the world. And these guys are just like, they're not my kids. Why should I care? It's really time. Let's clean the slate. Let's just replace all these people who don't care about children, and let's make it a new thing going forward, that people who are in these positions to take care of children, that they have empathy and they care about what happens to kids. I really hope that we can remove these people. Thank you very much for your time.
That concludes our request to speak.
Thank you. I'm going to take us to the consent calendar now. We have one item currently on consent, and I wanted to see if there are any items you would like to place on consent. Supervisor?
Yes, I do. So I wanted to have items 4, 9, 12, 14, and 13, except on 13 I wanted to make a comment on, if you're okay with that.
Yes, so you wanted to have 4, 9, 12,
14,
14,
and 13.
and 13. Okay, hold on one moment, because I'm just going to look how that lines up with mine. We don't get to talk in advance because of the Brown Act, so you get to see all this in real time. All right. So 9, 12, 14, and 13. Let me just look at 13 for a minute. I think that would be fine. I would like to keep 4 on the agenda, but 9, 12, 14, and 13 are fine. I'm also comfortable, but only if you are in adding the, 5 and 6. And that's the Valley Health related to Development of Youth Center for Evaluation and Advocacy. And I was just going to make comments to it, but if you'd like to hear them, I'm comfortable with that too.
I would like to hear 6. I'm okay if 5 is.
Okay. I'll add
On
5, and
consent.
I'm just going to make a comment about 5, but why don't we start with you, and then I'll make some comments.
Sure. So I wanted to thank staff for the report. I know that last year, I think the seniors agenda was based more around equity, and this year it's around, it's more of a focus on LGBTQ aging adults, and I really appreciate that. As we know, we have a growing population of older adults, myself included, and it's important for us not to keep our eyes off of all of the different populations that are special and unique about our county. And so I didn't want to just defer this without making this note that it is really important for me to know how we're faring, how our older adults are faring, and what services that the county is providing. I know this is a kind of a plethora of all different, a little glimpse of what the different cities and towns are doing around our county in terms of our older adults. But I really wanted to see what we also have to offer in terms of what we contribute in the seniors agenda, and it wasn't exactly clear to me. And so I was hoping to see potentially an off-agenda report or a meeting offline with me so that I can learn more about this. And we can be very clear about what the county is contributing versus how we rely on external governmental bodies or nonprofits or agencies to support the seniors agenda. And I know that we can't be everything to everyone. Obviously, we have to make sure that we collaborate and leverage each other's resources in a meaningful way. I just want to know what it is that we are doing, how our seniors are faring relative to our services.
So before you lean in, Supervisor, I want to honor the direction, and I want to just, I'll give feedback after Greta does, but item 5, I forgot. I meant to keep it off because they actually responded with what you asked for, and I wanted to get your feedback on it. So I apologize for that. So staff, sorry, you were ready to go. You have to stay. Sorry for item 5. So we're leaving 9, 12, 14, 13, and 17. And then, Greta, did you want to make a comment?
Yeah, Supervisor, I was going to just definitely accept the offer to schedule a meeting to talk through that with you, with appropriate staff, and then to the extent from that meeting there's additional follow-up that you'd like to come back through an off-agenda report, we're happy to get clarity on the specifics that you want to see included in that report, and then write a follow-up report as needed after a meeting.
Perfect. Thank you so much.
That'll be a motion?
That is a motion.
Great. I'll second that motion. And do we have any public comment on this
We
motion?
do have one request to speak. Janie Whitford.
Great. Welcome. Welcome, welcome.
Thank you. Good afternoon, and thank you for the opportunity. I sit on the IHSS Advisory Board here in Santa Clara County. I also am president of CICA, California IHSS Consumer Alliance, which is a statewide organization of advisory boards. And we have 25 counties currently represented. I am here to speak to the recommendations that we have given to the Board of Supervisors this year. You've gotten the packet. I just wanted to look at three of them. One is the Brown Act. You know, last year we tried to get the Brown Act changed so that boards and commissions that just give recommendations that have nothing to do with policy or finance can meet via Zoom and not have to meet in person. We will be doing that again this year, both at the state level, and really ask for your support in that issue. I know there's a lot of boards and commissions here in Santa Clara County which have not been meeting because they cannot meet their quorum, and that's an issue for all of us. I also want to highlight that we last year had meetings with the Board of Supervisors or their staff. That was incredibly successful. There's a lot of staff that really doesn't understand IHSS. When we have new Board of Supervisors, they don't truly understand the system. So we look forward to that opportunity every year of meeting with you, either with you personally, which would be delightful, or with staff, which would be even better, or both of you, which would be even better than that. I do want to highlight the issue with the IHSS social workers. Cindy, you know Supervisor Chavez so well what this is all about. And they are short-staffed, which means that they cannot do their work. They are out of compliance with the state, with their assessments and reassessments. So, and they have had others during the COVID, sorry.
Yeah, no, go ahead and finish that thought.
They were short-staffed, taking staff away from them. That was never renewed. And they've always asked for staff, so they are desperate for staff and clerical help. The only other thing I want to look at is collective bargaining. Consumers of IHSS have never been involved in collective bargaining, and we are very concerned that when we have collective bargaining here in the county for IHSS, providers are there, but consumers are not there to give their input and what they feel would be really beneficial for everyone during this process. Thank you.
Thank you. I appreciate your leadership and your years of dedication in this area. We're going to close the public hearing, and I'm going to come back. So we have a motion and a second. I do just want to add two requests based on what I just heard. One is that I know we're going to stay in a really tough budget time, but when the senior staff is meeting with a supervisor at NS, I think reviewing, if you're open to it, the staffing for IHSS is actually a really, really good idea because, frankly, we sometimes have a hard time getting IHSS workers connected to services and to health detriment that then causes people to go into the hospital. I mean, it's just kind of a vicious circle. So to take a look at the staffing ratio would be a request. And then a second point that I would make, as it relates to collective bargaining, I do think that one recommendation I would make through the county executive staff would be to talk to the governing boards about any of the needs that they see on the horizon prior to negotiations, because I think that's a very fair point, that there are lots of activities that happen in this area that you see firsthand that would be helpful for the staff to better understand.
Happy to make sure that happens, and also happy even in the interim between now and when we have bargaining to make sure there's good connection between agency leadership and the members of those bodies.
Yeah, that would be great. All right, with that, those additions, is that comfortable for you?
Yes, ma'am.
All right, so we have a motion and a second.
Vice Chairperson Arenas.
Yes.
Chairperson Chavez.
Yes.
Motion carries.
Great, thank you. We're going to move to item 4, and this is to receive a report from the Commission on the Status of Women relating to recommendations. And I'm just going to remind everyone that today we're going to try to keep our presentations to 5 minutes, and the reason for that is we actually have a lot on the agenda. I know we have a couple presentations that are just longer, but if we could just keep them as tight as we can so that we have time to have a conversation about them. So, who's presenting on item 4? Thank you, Marianne and your team. Appreciate you. Item 4. This is the report on the Commission on the Status of Women. Oh, Marlene, right, I forgot, thank you.
Yeah. Hello, thank you Supervisor Chavez, and thank you for having this item on the agenda. I'm the chair of the Commission on the Status of Women, and we have a report, the Women's Economic Security and Development and Leadership Summary Report. This basically came out of back all the way in 2021 when the county's Convention for the Elimination of Discrimination Against Women Task Force finished up. It had some priorities within that work to improve the lives of women in the county. And the commission felt that it was important to look at some of these priorities and investigate locally and with some, nonprofits on the ground and kind of, talk to the community and see about two priorities within that, which was economic security and development and also leadership for women. And we actually put a call out at our Women's Equality Day, where some of these CBOs that are, noted in our report and others, to reach out and really just listen and see what their recommendations are related to these issue areas. And the commission put together an ad hoc to work on this of a few members. And around the same time that we were actually engaging in this, California also came out with a blueprint of women's, pandemic economic recovery. It was all very relevant to this work because at the time we were all coming out of the pandemic and, supporting women on different issues related to, their economic development and security, and having basic needs met and leadership was really important. And we ended up in our ad hoc speaking to 3 CBOs. It was the Latina Coalition of Silicon Valley, which actually came and presented to the commission. And we had the Lead Filipino and also Vegelution, which is based in Eastside San Jose, give us recommendations related to these areas. And those are all included in the report, exactly what they shared with us related to recommendations. I would say there was obviously some, and it's interesting because we spoke to all these CBOs, right, individually as an ad hoc and gathered all this information and put it into the report. And there were definitely recommendations that the ad hoc felt rose up to be, really important. And so I just want to highlight a couple of those that I think, and those are in the summary of the ad hoc recommendations. And some of them are, supporting women by encouraging family-friendly leave policies and affordable childcare options. And that, came up when talking with CBOs. Continuing to expand the guaranteed basic income programs for low-income women and families. I know that's something the county has done, with other, trying out the basic income program. So basically expanding that to women and families. Eliminating unnecessary economic barriers for small and micro businesses, to cultivate a friendly business ecosystem, essentially removing fees for first-time businesses, and also protecting the home-based food businesses at the same level as home-based childcare businesses. And also, I want to note, investing in the technology and the training, career development of justice-impacted women in and out of incarceration systems. That actually is also included within the report. We had a public listening session last year, and that information and recommendations are included within this report. We thought it was important to lift that up because that's another highly impacted group of women. And those are just some of the things. The other thing I would note, the ad hoc gave a recommendation about creating or developing a public data dashboard that the county can have for gender statistics with the goal of just supporting transparency around gender equity, pay equity, other analysis within the county. So that is also included in the report. And there's a lot of other recommendations, but I just wanted to raise up these main ones. Thank you very much.
Thank you. I'm going to move to public comment if I can, and then I'll come back to the board.
We have one request to speak. iPhone 56. You'll have 2 minutes to speak. Timer will start when you begin speaking.
Yes, one thing that I think that was lacking from the report on improving the lives of women is actually getting in there and protecting them when they're young, when they're still like adolescents and young children. I mean, my daughter, she's been sexually abused. I mean, the signs are all there. Her personality changed drastically and suddenly. And my other daughter was placed in the custody of a man who previously drugged and raped a teen. And this was against an agreement that I made with that mother. I mean, it's just there's a culture in this county that just children in general, they don't matter. I mean, they're disposable. You can rape them, you can abuse, you can kill them, you can do whatever you want to them. And the people who are responsible for protecting them, they get away with doing anything they want. And I mean, this is really up your alley. I mean, you're the Commission on Women. I mean, doesn't it bother you that that my daughter? I mean, what kind of future is she gonna have? I mean, she's got to have a horrible, horrible future of mental illness and stress and anxiety and all that stuff. I mean, how is she going to be a functioning adult when the county just lets the abuse go on and on and on? And for years now, I've been begging, at least get a screening. A screening. I mean, I'm not asking for much. I'm asking for a screening. I mean, my son, he's already confirmed being anally raped. I mean, can't we get a screening for the other kids? I mean, it's just terrible what's going on in this county. I hope we can correct it. I really do. Thank you for your time.
That concludes our request to speak.
Thank you. I'm going to close the public comment. I'm going to see if there are any comments from my colleague.
Yes, there is. First of all, I just wanted to thank Marlene and the rest of the commission members for their work that they've been doing. This is a very interesting report to read, and one of the questions I have for Marlene is, I know that there's a couple of agencies mentioned in the report, and I don't know if maybe I overlooked this, but I'm wondering if you all connected with Sacred Heart for their advocacy on the PASOS program. This is for undocumented seniors, pilot program that they're hoping to, well, that they're advocating, and this is under the basic income. Have you connected with them at all?
I haven't connected with them yet, or the commission hasn't. But I mean, that sounds very interesting. It's called the PASOS.
Mm-hmm. It's called the PASOS program. Coincidentally, and actually I don't believe in coincidences, I always think that the universe kind of brings you together to folks that you actually need to connect with. And today I was the table captain under the Silicon Valley Council of Nonprofits. This is why I'm dressed this way. Just FYI, everybody, I'm dressed like Daphne from, Scooby-Doo. This is not my normal wear. And so I was there, and it just, they reminded me of this program that they had advocated earlier in the year for, and so it just really coincides with your report today as you were talking about, the basic income support within your own recommendations, and I thought this would really fit in well. I'm hoping that maybe offline we can connect and talk a little bit more about it, but I'm glad that you're able to write this down and follow up a little bit later on it, Marlene.
Yes.
Thank you.
Thank you so much, Supervisor.
And, and those were my comments. I know that we are not where we need to be in terms of on the status of women in general, and I know that whether we are in a fast food environment, at home, as supporting our children, or whether we're in a legislative or advocacy role, we all have our different barriers that we're facing, and I just want to thank you for acknowledging some of these difficulties in creating some recommendations on behalf of women in this county, so thank you.
So with that, I want to make a couple of broad recommendations. First of all, I think the combination of doing outreach, so for all of you who are on the commission and who are doing this work, thank you so much for reaching out. And I do concur with Supervisor Arenas that I think it's a great idea to talk to Sacred Heart because it's a different group of women and they're older and should be part of these discussions. One question I have, and I don't see if Cassandra is here. No, she's not. So then what I'll do, Julie, through the county executive, just make a couple of observations that I'd like to ask the commission to consider. One is that the framework that's in here, both from the commission but also from the state, it looks like it's the state CEDA task force. Also, there are some really good policy recommendations, and one request that I'd like to make is, while it would be difficult, I think, for us to review all of these, I would like to ask that there be a sit-down between the Commission on the Status of Women and our Intergovernment Relations Group, because there are a number of these areas that we're probably already doing some work on, but more that needs to be incorporated. And we're going to have that discussion at the end of the meeting. But I would just like to ask that IGR meet directly with the Commission on the Status of Women, appear at one of their meetings, and then because one of the things I think would be interesting is to understand which of these are going to be prioritized for statewide initiative and which of these should be prioritized wearing our hats as both an employer but as a community advocate, and frankly, even taking a look at whether or not we need to update some of our own policies. But the way this is presented, there are so many interesting layers that I think they may need to be just sort of teased out a little bit so that we can hold ourselves accountable to making sure we're following up with the priorities of the commission.
And I see some nods from our staff in the audience who can facilitate making sure that sort of a meeting happens quickly.
That would be great. Thank you. And with that, I'd like to move approval of these with a little bit of more refinement in terms of which organization they go to, accept the recommendation to make sure we're having a conversation with, or our crew is having a conversation with with Sacred Heart, and that would be my motion.
Second.
Great.
Vice Chairperson Arenas.
Yes.
Chairperson Chavez.
Yes.
Motion carries.
And thank you all for working on this. This is really, really moving in the right direction. I'm very, very excited about it. We're now moving to item 7. Oh, no, I'm sorry, item 5. I apologize. And I would like to ask whoever is presenting on this item, if you could come forward. Welcome.
Good afternoon. I think the report today is in response to Supervisor Arenas' request to have a graphic illustration of the referral workflow for the Pediatric Developmental Specialty Center. So it's embedded within the report, and I think there was also a larger copy that was added to the packet. So here to see if you have any questions and if I can clarify anything with you.
You know, I would just make one request. And you probably don't have it available for a slide, but I think if it's okay, Supervisor Arenas, I would just like you to walk through it, if you wouldn't mind. And do you, by any chance, have a slide?
I do not have a slide.
Okay.
And Dr. Whitgob is not available today, so I will do my best to walk you through the workflow.
And I'm actually just looking to see, I know it's in the packet, if there's any chance that any member of our clerk of the board staff or technical staff supporting the meeting might be able to pull up the slide that I'm seeing printed in front of Supervisor Chavez. It's a multicolored flow chart that would be as part of the packet on this item if possible. If not, we'll just talk it through.
Oh, great. Thank you.
Magical.
Thanks, Greta. Okay, so let me walk you through. There are referrals that are received, or let's say the patient has a concern. So there's a concern regarding the child. So it starts with the caregiver, teacher, therapist, whoever. The child gets referred to their primary care provider. From the primary care provider visit, there are a number of resources that are listed there: school evaluation, early start, audiology, mental health, others where the provider can directly refer. If the services of the PDSC are needed, on the graph there, it shows our different locations, so the referral is made. The referral is then reviewed and sent to the appropriate team members, where they will look at the referral and the reasons for referral and any of the concerns. We then partner with Parents Helping Parents and also the Santa Clara County Office of Education to conduct a pre-workshop evaluation with the patients. In that process, while the patient is waiting for a full evaluation, they are kind of handheld to work on letters to the school for the evaluations, collect any necessary records, connect with any key resources through Early Start, and just really make sure that the parents understand what the process moving forward will be and make sure that they are well supported in that process. And then from there, they make it to the clinic and they get the comprehensive evaluation where everything is looked at, and then from there, the diagnosis and the recommendation for additional services and/or recommendation for follow-up from there. There are multiple navigation touch points. We have contracts with Parents Helping Parents in Santa Clara County Office of Education, so the school liaison has been a really critical person in this practice to help connect the dots with the schools. And the folks at Parents Helping Parents really walk through with the patients and the families all the things that are expected and are always there to answer any questions. So then the child has ongoing developmental, behavioral, pediatrics visits with the providers. And then we hope that they will grow and progress well and address any of the needs along the way. So that's the workflow. Do you have any questions?
So let me first see if there is any public comment on this item.
There are no requests to speak.
Thank you. I'm going to close the public comment, and I'm going to look to my colleague, unless you'd like me to start. Okay. So I'm going to direct my comments toward you. I think that, overall, one of the goals has been to make sure that we have services available for families that have a need and see a need, and have a process that really supports families while they're going through the whole wheel of options. And one of the concerns that I have is that as the program gets developed, that it's very clear to us what the connections are for all of these handoffs. And so I have had the opportunity to meet with staff, and I think that there are kind of two big buckets of activities that haven't really been fully addressed from my perspective. One is that the initial thinking behind this body of work had been to have a physical one-stop center, so that when a child and their family were referred, that they would have more of the child advocacy experience, meaning that you'd have somebody from education, somebody from Parents Helping Parents, like in real time, available to work with the family. The second part of it is that many children, many of these particularly low-income children, have a more difficult time, and their families, accessing legal services that would make it easier for them to deal with the schools. And so the group has asked, because I'd asked them to come to do more regular check-ins. They've asked to do them, I think, annually, and I think that's going to be up to I'm saying yes because it would be up to the future board. What is a bigger concern to me is how we evaluate the effectiveness and whether or not we've had the appropriate reach into this population of people who have very serious challenges. And I don't know how to evaluate that, and I frankly don't know how to even give feedback to that, because these programs still seem relatively small, and I think they're starting out. And I think where we have psychosocial developmental challenges, that the type of assessments that are really expensive, take a long time to get, that I'm really wondering, for high-need families, how does this process work for them today? And, and it's better than it was, so let me just say that, and I want to, I think Dr. Whitgob's a saint, but I'm not sure I understand how to appropriately say, this is working.
So let me just make sure I'm hearing two questions from you. One is are we missing people who should be going through this process because they're never finding their way to our services, is kind of one question. How do we measure that? And then the other question is, what really is a family's journey? If this is the steps they're going through, how long does it take? How easy is it for them to get through this process? And where are opportunities for us to enhance it as we go along, so that we know, given how high need some of these kids and families are, that it's as easy to navigate and as quick to get through a process while still being really high quality and thorough. Those are kind of the
Yes, and
two.
I would just say that, Greta, part of why this has been hard for me to wrap my head around, and Sylvia, this is maybe something that you've experienced also, which is that to get into to get the services you need from a school district or even from San Andreas Regional Center, the gap between the need being identified for your child, the services that are being recommended, and then being able to get them in the partner agency is yawning. And I see here that it has Law Foundation Medical Legal Partnership, which I am really excited about, because, but as an example, I don't know, I would want to understand, is the county able to bridge that gap in partnership with these agencies that we actually need to be responsive to these families, or they end up in any one of our systems, right, any other way? Yeah, so that is the question. Thank you for being so concise and precise.
Yeah, I'm happy to see what information we can provide on that today and to bring more information back. I'll just, share my own perspective that I do think that while, as you said, I think that this workflow reflects a lot better service, more support, more high-touch hand-holding through a really complicated process. There are a number of entities on that list that I know we need to partner with, and they have their own challenges. We've had our challenges in our partnerships for some of these really, really high-need kids, and that's not unique to our county. Regional centers, for example, I think are quite challenged statewide in meeting their mandate, and it's also challenging for county behavioral health departments and child welfare systems who rely on regional centers to do their part of what's a shared responsibility to care for certain kids with really high needs, struggle and then kind of holding the bag where we see some of our partner agencies really struggling to meet their part of the pie. So I think you can get more detailed information on that, but I do think what you're naming is a continued pain point, a hard one to solve, but one that's very real, really impacting families, and one that we really need to keep working at.
And through the chair, can I contribute to this part of the conversation? Because I think back, like, as a parent, it's one of the reasons I got into this business was because, I was doing intervention. I was doing early childhood assessments at the clinics, and I saw how the majority of the kiddos, majority Latinos, majority boys, had behavioral issues, and they would return, when the parents would return for their next visit, I would ask, did you connect with, or in between the visits, I would call and ask, did you connect? they would say, oh, no, the teacher said, it's always in Latino culture, what a teacher says is like sacred, right? Because they hold a position of respect and power within that community. And if they say that you don't need it, then you don't need it. And a lot of the times that's the school district's message of, we don't want to spend that money, especially if you're between 3 to 6, right? And you're no longer qualifying for early start, and 3 to 5, that's the district, but you're not enrolled in any particular grade just yet. And it's so easy, and the majority of them would get lost in the shuffle if we didn't have, this generic letter that we would help develop so that it could begin this legal timeline with the special education director in that particular district. So you have to know what it is, in terms of technical checkoff list. Otherwise, they get lost in the crowd. And when we think about the overrepresentation, this is part of the conversation, what was it, on Tuesday, that we were talking about, of Latinos and black and brown children in our system. This is where it begins. You can't get more upstream than this. This is where it's at. And I think back to my days. I was in the field. I know what I was talking about, and yet I was still not being rendered, or my child was not rendered the services that he needed. And so then it makes you angry because I saw what was happening with the rest of our community, and it really propels you to come into a place where you weren't thinking of coming into, like I did it as a school board member, and then I felt it wasn't enough to do just that. But for me, I saw what First Five did in terms of a continuum of care system for children 0 through 6, and we just don't have that continuum of care system that I see that holds everything comprehensively. And I think it's about time for us to do that, because we serve beyond 6, right? And we need to catch these kiddos. I was talking to a parent just yesterday. I mean, it was a foster, a step parent of this kiddo who clearly needed psychiatric care, and our systems just don't know how to deal with a very severe condition as the one that was being mentioned. And when they're neurodiverse, it's just, it's too expensive is what they heard them say about our system, that they couldn't provide this. It took that parent 3 years to get an assessment. And in the meantime, the psychosis of that child is just, when you can actually prevent at an early age, it just deteriorates, and our system is not contributing to the improvement of that. And so for that, and for so many different reasons, and for what I've experienced, it's just, I think this is part of this question about how do we hold all of this system together. And I appreciate this visual process, but I think the question still stands in terms of how you asked it, Supervisor. Because I think it's hard to grasp this process when we don't have a continuum of care. We're not the gatekeepers, right? We're not holding all of these different elements together so that there is this transition from one place to another. And I think that's, for me, this is where I'm grasping at. I mean, this is clearly outlines all the processes, but, who does what, the diagnosis and recommendations, and we can list all these folks. I just don't know what their roles are.
Yeah, I think you just hit the nail on the head of one really significant challenge that we face in serving well the needs of some of the kids that come through this system and other related systems, which is the state has allocated different roles to different agencies, which then means families have to move from one agency to another, and we do a lot of work to try and smooth those handoffs, give information exchange. When you heard in the description of the workflow, us trying to put together packets of materials and the letters like the one you referenced, so that we're helping families do the work to navigate the system parts that are outside of our control. But I'll give a really concrete example. Early in my tenure in the county behavioral health department still provided for kids who had an IEP the behavioral health services that they needed and were entitled to under their IEP. That responsibility then transferred back to school districts. So at least when that was part of the mental health department's mandate, there were challenges with that because we had to work in partnership with our districts. But then whether they were getting services under their Medi-Cal benefit or they were getting services under their IEP, it was the same county behavioral health department that was the provider of those services. That then got split off. And so now you have the IEP covered services from the school district, maybe very similar services coming to that child through the behavioral health department, through their Medi-Cal benefit, or through their primary care provider, through Santa Clara Valley Healthcare or one of our partner clinic agencies. And that creates a lot of very real and understandable confusion for families. There may be times where it's easier for them to get the same services under their Medi-Cal benefit or for them to get those services and more through the same provider under their IEP. And the fact that some of our own county employees who have children experiencing these struggles, who have every opportunity and really robust insurance, still experience some of these challenges is, I think, illustrative of the really big things that we're trying to surmount through programs like this for our families with far less access to that level of support and resource. So I don't know, we've talked a lot, if there's anything that you'd like to add to the discussion in response to the questions, but I definitely think the concerns that you are articulating are absolutely ones shared by staff and ones that this type of workflow is really designed to address as best we can, given that there is this sort of split responsibility for delivering services to the same set of kids.
Well, that continuum of care, that system of continuum of care, I think, and I'd like to see that developed in a way that we are holders of those services, irregardless of whether, right, it's who the provider is. And there's so much, like I've been very honest, I typically am on the dais. I said, no, thank you, school district, because you're going to give me an intern for my child for support. And that's going to change as soon as the semester is over. And stability for that child is much more important than you practicing on my kid so that you can get hours for whatever it is that you're pursuing. It just isn't fair for the children who are in our school districts who don't have access to many different resources. And then we can't then say we're going upstream if we know that this is not a good practice, if we're trying to create stability and we know that this is a practice that everybody holds, yet shrug and hands up in the air. What are we doing about this? And how are our systems talking about it with one another when there are some practices that are just standard but are not conducive to creating stability in relationships that research show creates resiliency in our children that will then allow them to fare better when they get older. I mean, we know all of these things yet. And so for me, in terms of this particular item, I think did you make a motion, Supervisor? Because I'd like to accept the report and then also include for the next steps in terms of what this represents. This is great, and this is, I think, part of our learning process, but I'd like for us to begin to have a conversation on developing that continuum of care, that system of continuum of care, so that we have these discussions about the obstacles in the road for our families, for providers, for stakeholders, for whomever it is, and that we can actually come up with solutions collectively as a community. We can't get more upstream than this. And if we don't make these changes now, we already know we're in a mental health crisis. We've declared it. We've all accepted it. We understand that the pandemic has created an impact for our children, And our boys are going to be, they're on the losing end of this. We already see it. We know it from our probation department. And there is a report that reflects that 52% of the kids that were in probation last year had an existing referral from, or an existing case under DFCS. And we just know this pipeline. And so if we need to create a body that continually looks at our system and that interrupts or creates more transitions, or that, establishes best practices and just really unifies us in a comprehensive way versus each department doing what they're meant to do. And that is all great, but we need to connect all these dots together. And I apologize that we're putting it all on this particular part of the system. It's so important, right? This is an entry point. And so I don't mean to put it all on the shoulders of the youth center for evaluation, but to me, it's a pinpoint.
I definitely understand your point, and I just also wanted to point out that, we do have a pretty robust pediatrics program or services within our health system. So when we point to the primary care provider, they're not usually outsiders. They're like within our system too. So at least to that extent, it's within our health system, at least within what we can control of the process, and then bringing the partners in. So I just wanted to point that out.
I totally appreciate it. I'm sorry, through the chair, if that's okay. I appreciate that, and I think that's excellent. And now we also need to make sure that whoever is coming into the life of that child as a provider or as a school liaison or as a whatever it is, that they all fall within in lockstep in terms of what we're all trying to achieve. And we all have different purposes, but we're all trying to create some prevention, right? And so anyways, I'll get off of my.
No, you did great. I'm gonna say for the motion, the purpose of the motion, that the next step is to actually review the health and vitality of the continuum of care within this particular system.
And systems that contribute.
Feed into it,
That feed into
absolutely,
it,
yes.
yes, absolutely.
So, and that would be your motion.
Yes, ma'am.
And I'll second it. I do just want to add one thing that and I'm going to share this with you, because when I met with the staff and they were really gracious with their time, I realized that there was a very big miscommunication from when this work was being discussed on the dais, and then how it got expressed into the work of the staff. And this was not on you. This is actually something that we all collectively here, the leaders of departments, need to do a much better job of getting information down to the staff that's actually doing the work. So the point I was raising is that when we were initially having the discussion about the Child Advocacy Center, the Spark Clinic, and then this kind of, for lack of a better word, sort of reimagined approach that Dr. Whitgob was taking at the same time we were having conversations here, was that at this dais, and I think it was with Dave and I, we were having a conversation with Dr. Smith about what would a center of excellence for children look like at O'Connor Hospital. And that idea around a center of excellence was a little bit, the idea that we were going to be providing and really leaning into providing services for high-need children in a way that people, nurses, doctors, others would want to come and work here, because they would see that we were actually able to do the interventions, as you talked about, do them deeply, do them upstream, and then have a system that we were able to really respond. And I just want to emphasize, in particular, what we were focused on was the schools, because of the number of complaints we got from parents that they were getting their referral slips, they were getting their IEPs, and then they were getting just bounced all over the place. And then the other was SARC, because we have so many children that are diagnosed late, and you have to be diagnosed before you're 18 to get services from the state. And so all of that is what prompted this bigger discussion. Now, when I said to the staff, I said, oh, Dr. Smith had this idea that we'd have a center of excellence for children at O'Connor. Not one of them had heard it. And I'm not, again, I'm just saying out loud to all of you, you all play a leadership role in the organization, and the translation of the discussions here are actually pretty important. I don't think that was a missed opportunity. I more say that because the idea was thinking about how many services could we make easy for communities to access when they were in incredibly vulnerable situations. That was the idea behind the Child Advocacy Center, and it was also the idea behind this what I was referring to as a diagnostic center, because where I've seen parents really veer off is in this situation where they don't think they can afford the services their child needs. They sometimes opt out because they're embarrassed that their child has these needs, and then we see them later on. And anyway, so all that is to say that to me, it's a little bit of a cautionary tale about the discussions that happen here. But the second is that at some point, it would be worth marrying the vision behind how these services are aligned. And again, I think the staff feels that they are aligned. As a person not engaged in that system, I don't quite see the alignment as clearly as they do. And again, that may have more to do with just my exposure to it. But I want to just lean in and say the connection, the collaboration, and the outcomes are going to be pretty critical. And looking where we have partners that have serious expertise that we could be using today to beef up the system would be something I would just recommend as you take this look. Because I think it really is an analysis that we're asking for, not an outcome. I mean, it's definitely got an outcome to it, but I just more mean in terms of next steps.
Well, and if I may, just to make sure that we do bring back to your point about making sure that there's good translation from the conversation here to then what gets brought back to this committee and to the full board. And hearkening back to some of your earlier questions, I heard two bodies of work. One is looking at how are we making sure that we're getting all the right kids to actually come through this pathway, and what are the things to look to on our end to know the answer to that question. And then number two, and this reflects also what Supervisor Arenas was sharing, if I'm capturing it correctly, is really looking at what are the key moments in that journey that might be creating a real challenge for families. A lot of it probably having to do with where there's multiple different entities, organizations, systems that family's having to interact with, and what can we lift up as opportunities for us to keep digging in to make it easier for families to make it through that system successfully toward progress, so that we can then tee up whether that's legislative opportunities that we can pursue that allocate responsibility more logically, deeper partnership with some of our external agencies, or a better understanding of their resource limitations or their service limitations, but kind of bringing back what we think are some of those pain points that we can continue working on. Is that consistent with the direction?
That's great.
Okay.
That sounds great.
Yes.
Yeah, that's great. That's clear? Okay. And thank you. So we have a motion and a second, and we've already taken public comment, so
We're done. Vice Chairperson Arenas.
Yes.
Chairperson Chavez.
yes.
Motion carries.
Thank you. And just to say aloud, this didn't exist before, so well done. So we're moving in the right direction. I don't want anybody to feel like we're not appreciating them, and yet we always ask more. That's our role here. All right. We're going to move on to item 7. This is the Vietnamese American Service Center, our status update. And Hani, are you back from jury duty? Welcome.
Supervisor, did you leave 6 on the agenda?
Let me just look really quick. Oh, we did. I apologize. You're right. Sarah's like, are you kidding me again? Sarah, you were so calm. You didn't lunge out at me.
No,
Thank
I
you.
looked over at Michaela. Okay. Well, good afternoon, Chair Chavez and Vice Chair Arenas. Sarah Duffy, Chief Children's Officer and also Deputy Director of SSA. I'm joined here with staff of the Office of Children and Families Policy, Arcel Bluma, Director of Strategic Initiatives, Karina Alvarez, and Melissa Liu, Senior Management Analysts. We have a PowerPoint that we can walk through. We also have the annual report attached with our work plan for this year too. So let me know if you'd like us to walk through the PowerPoint.
What would your preference be? Did you have questions, or you want to hear the presentation? Yeah, this is, actually would be great to hear it, if you
Sure.
wouldn't mind. I think this is one that we are kind of excited about. I mean,
Okay,
we're excited
sounds
about
good.
y'all, but this is one that we've been waiting for, so, okay.
Okay, Karina, will you pull up the slides? All right, thank you. Okay, so I'll start with giving you all an overview of our second annual report, and then I'll cover highlights from our work plan for the current fiscal year 24-25. And to start off, the Office of Children and Families policy vision is that all children and families in Santa Clara County have the supports they need to be safe, healthy, and successful in learning and in life. Next slide, please. And with that, we will present some, oops, sorry. Okay, so the work plan that we have for our office is guided by 3 core objectives. The first is policy and analysis, and that is following and advocating for local, state, and federal policies that will facilitate equity forward and data-driven decisions. Collaboration and partnerships, which is cultivating and increasing collaboration across county departments and with external agencies and community to improve outcomes for children and families. And third, strategic issues and initiatives, which facilitate implementation of promising new initiatives that support and strengthen, in particular, early interventions and prevention practices. Next slide, please. Okay, and so with that, I'll share highlights from our first annual report, from our second annual report. And in doing so, I really want to thank the Division of Equity and Social Justice, which was a great collaborator in many of our projects, the Board of Supervisors and staff, county and external partners, many of whom are real leaders in the work serving children and families and were expert advisors in a lot of our projects. In terms of policy and analysis highlights, we advised on the 2024 Children's Data Book, which is coming back to this committee for a presentation in the spring, I believe. We collaborated with the county's intergovernmental relations team and submitted letters in support of 9 different bills. And we partnered with the Office of Budget Analysis to gather programmatic and service data for the upcoming Children's Budget Book. And we've been presenting quarterly updates on that project at FGOC. And I think we are coming back to this committee with OBA when the children's budget is released to present on that here. Next slide, please. In terms of collaboration and partnership highlights, a lot of our work relates to partnerships, and highlights include participating in several local advisory and planning bodies in different areas of family and child well-being. And I want to highlight that in April 2024, alongside our youth task force, our office co-hosted the first youth summit at Oak Grove High School with the theme of improving school-based wellness, which was a big success. And then in June 2024, we launched our first summer internship with the Youth Task Force Commissioners, where they worked on foundational projects for this upcoming year's work plan, focusing on homelessness and on access to post-secondary opportunities. On this slide, we highlight our work related to mental health and well-being, and I'll pause and just say that a lot of the strategic initiatives in our work plan are really grounded in the 3 areas that were identified in the Children's Roadmap to Recovery, which was passed by the Board of Supervisors in 2022, and those focused on mental health and well-being supports, as well as access to early learning and child care resources. So a lot of these initiatives are going to be in those 2 areas. On this slide, there's highlights around the work that behavioral health really led around expanding access to school-based mental health and well-being, funding 40 schools to receive $13.2 million in grants designed to expand and open new school-based wellness centers. I believe the grants are covering 28 new school-based wellness centers and upgrades to 12 existing centers. And our office has been helping with strategizing on how some of these wellness centers will be operated, particularly with feedback directly from students and young people. The Youth Task Force has done some very helpful information gathering through surveys of high school students on what high schoolers really want to see on site and in terms of their mental health and well-being. Okay. We continue working very closely with First Five Santa Clara County to launch and continue child care and early education initiatives. We have our TK Equity Initiative, which supports a diverse body of local early educators interested in applying for higher paying, benefited, and union protected jobs by removing barriers and supporting access to higher education credential pathways to become TK teachers, and that launched in the last few months. We have an ongoing apprenticeship initiative that creates an entryway for licensed childcare teachers to enter quality early learning and care workforce. And the third is the Shared Services Alliance initiative that provides support for family child care home providers to retain their workforce by sharing costs for small business supports and promoting quality early learning environments. And then this is a very exciting project that's really starting to happen right now, and this is the Child Care Expansion Grant Program. So in 2023, the board approved $15 million in American Rescue Plan Act funds to assist child care providers with construction, renovation, and operational needs with the goal of increasing child care enrollments throughout the county. There was a great deal of outreach that happened, and it led to almost 500 applications being submitted by November 2023, with requests totaling over $85 million. So a huge amount of interest and capacity to expand childcare slots. In April 2024, the Valley Health Foundation, who's been overseeing a lot of the grants process, began issuing notices of intent to fund grants to providers on a rolling basis. In May, the first grant agreements were completed, and we anticipate with Valley Health Foundation that over 50 grant agreements will result from these funds, and it seems like new grant announcements are happening every week. So that's been really exciting and fun to watch roll out. Next slide. And then as we are in the current fiscal year, we have a work plan that identifies the current priorities and projects for the office. And that's attached to the legislative file. A couple highlights. We're continuing to work very closely with the Office of Budget and Analysis on collecting more comprehensive program and service data for the children's budget. We are doing some very focused partnerships to make more population-level data available to local children and family policy advocates, and some partnerships around collecting data from parents of early child care providers, as well as expanding the reporting of adolescent mental health and well-being, survey data. We have our continued monitoring of the child care expansion grant making, the early child care workforce supports, policy and planning projects, and then of course continuing to support the youth task force. They just held their annual retreat last weekend at the VASC, and we have all 16 commissioners seated, and I think it was a really good day. We started with parents coming in and learning more about the program, and then had presentations from IGR, the Social Services Agency Youth Participatory Action Research Team, and then the interns on their project. So that, I think, was a great retreat. And this concludes the presentation, and happy to answer any questions you have.
Great. So first, I'm going to see if there's any public comment on this item.
We have one request to speak. iPhone 56, you'll have 2 minutes to speak. The timer will start when you begin speaking.
Yeah, I'm beginning to think that some of these reports, presentations are a substitute for actually doing the work. I mean, because it really does, it sounds grandiose. It sounds like you're doing everything you can to facilitate the well-being of children. And it's not the case. And I don't know why Sarah Duffy keeps, or anybody from social services and DFCS keeps making these grandiose presentations when 3 kids died this year, or in a 1-year period, and you can't even get my kids a screening after my son is reported being anally raped, beginning at the age of 13. And this is happening to countless other kids, parents, and kids. I mean, there's Catherine Campbell, there's Daya Baran, there's Violet Brooks. I mean, there are kids being raped in the county, just turning a blind eye because some attorney and a private attorney and a retired judge, they want it. They want the abuse to continue because that's really how they make the most money that they can, is by allowing the abuse to continue, and then one parent pays just to stay out of jail, and the other parent pays just fights to protect the kids. I mean, it's just it's a terrible thing what's going on in this county. And Sarah Duffy, really, she should be ashamed of herself, because she is knowingly and willfully, as she sits here right now, she's allowing my kids to be sexually abused. I mean, it's just this narcissism that I'm the best and my kids are the best and your kids are shit. I'm gonna piss on them because they're worthless, they're whores, they're nobodies. And this is the attitude that she has, and that Daniel Little has, and Wendy Kinnear Roush has, and Damian Wright has, is that the kids are just shit. And we need to change these attitudes. It's terrible. Thank you for your time.
That concludes our request to speak.
Thank you. I'm going to close the public comment, and I'm going to see if there are any comments or questions from my colleague. What's that? Would you like me to start? Okay. So first of all, I wanted to say that this is incredibly important work, and it's really advancing many, many ways the way we're treating children in our community. And so I want to say thank you to all of you. I know it's hard, and I think especially because we're asking you and have asked you to do some new programming, particularly around child development in partnership with the Valley Medical Center Foundation. We're now in the loan business. So these are all new bodies of work, and so really appreciate the leadership that you've taken. I have two broad questions about sort of the next steps. And one, I think, is really important, that you're playing a leadership role in helping to inform research done by other partners. I think that is incredibly important. My question, from an overarching perspective, is do we foresee in the next few years changes to the child data book based on work and research that's independently being done by the county? I don't know who to ask that of, so.
Yeah, I can answer that. Let's see. We are just in the early planning stages of the children's data book, and we met yesterday actually as a team to think through what are the data points that we want to add to the book. I think the short answer is yes. We're always thinking about what additional data we want to add, and what our office started doing last year, or maybe 2 years ago, was starting to be the convener of all the different data points that the county collects as it relates to children and families, and we connect with all of the different departments to add that data. So, for example, Public Health is working on the Latino health assessment. We want to make sure that we can gather data from that and make sure that's included in the report. We also have a couple of data projects that we're working on that I kind of very briefly referenced in the presentation that we're really hoping we can include in the data book that will be really helpful. One is we've been doing some really intentional partnership with the Silicon Valley Community Foundation and with First Five to get more engagement with the RAPID survey, which is done by Stanford, and it collects information on what are the needs of parents 0 to 5, but really trying to go into the communities that have been underrepresented in that survey and encourage participation through partnerships with nonprofit organizations and First Five. So we can, and that's a really interesting survey that happens monthly, where parents are resurveyed to ask them, do 5-minute surveys on how are they doing at this point in time, what do they need in terms of services, resources, of course a focus on childcare. So we want to have more participation in Santa Clara County and more participation in communities where we want to make sure we're supporting. So we're very excited about getting better data in that space. And then for many years, I think the county's been really interested in a lot of different partners and better data from students on their adolescent mental health and well-being. So that's an area where we're really partnering with Dana Bennett, Kids in Common, Public Health Department, County Office of Ed, school districts to figure out how we get better reports out on how teens are doing, particularly in terms of their mental health and well-being. So we should have some of that data in the next data book. If not, we'll be describing kind of where we are in the process. Hopefully that helps answer.
Yeah, it does. And I'll just say that to me, one of the most important parts of this document is the appendix and the work plan. And so one question that I have is that, you know, initially when we were, part of the reason I was so interested in having your office, Sarah, is that when I was here and like a brand new board member, there were two things that I found alarming about this meeting. One, that the county executive and not even the CFO, we didn't even have a Greta, that came to the Children's Family Seniors Committee meeting ever. And if you ever went to a hospital meeting, you not only have the dais filled, but the audience filled with all kinds of people who care about what we were spending, what kind of policies we were doing. But in this committee, very little interest. And so prior to talking to Susan, I had thought to myself, you know, if we had a children's, and I know this is people don't like this language, but I thought if we had a children's czar in the county who had the ability to take policies that came out of this committee and implement them countywide, it would allow us to do three things. One, to be truly prevention-oriented. And I think that's really something you spoke to a minute ago that I thought was a really excellent point, that we were getting upstream, and therefore, that the county's idea around being a safety net would mean that we were really shifting our attention to not needing as much of the safety net. So that was one. The second is that I was so, frankly, concerned that we didn't have leadership in the organization that woke up every day thinking about how are we dealing with children and their families, that many policies that the board was interested in and passing were not being implemented to the fidelity of the ideas that came forward because there was nobody whose job it was to make sure that we were meeting these goals. And third was that my assumption had been that the office in and of itself would start to be able to create more of a locus around how we think about children and families writ large in the world of everything, development, all the things. So I say all of this because as you've changed roles in the organization, that initially when we brought this forward, we wanted the position to look like, almost like the CFO. In my mind, it was, we'd have the CEO, the CFO, and this chief children's officer bugging everybody to really be moving toward prevention. And I say that because really, at some level, Greta, this will be all of your decision about how this gets addressed in the future. But I do want to say that of all the work that I've done in public life, and you know, I can go on about, yeah, that we did this, we did that. The two hardest areas to move the dial have been on women's issues. In fact, that's been by far the hardest. Someday I can talk to you about that. You've experienced that too when we were dealing with sexual assault and all the other things where people were like, no, we can't do that. That's not blah, 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 all that. But the other has been to get institutions like this that are big and bulky to adopt meaningful change across all of the departments, even when the vision of the institution is crystal clear. And you know, the meetings we had earlier today, we have similar challenges. So I say that because before the staff comes back with a recommendation about how the position should be filled, I think one of the questions really is, and it's an important question, which is, how are we prioritizing children and families? And what are the implications of that relative to whatever the emerging structures are, Greta, that you and James need to implement and create to manage such an incredibly big organization? I don't have an answer. I had a really big opinion about it before you came, Sarah, and you know, and I was persuaded otherwise, and now I feel like I was persuaded wrongly. But I think, as you all are thinking about how to make this work more real and meaningful, again, cross institutions, you know, in this big organization, I think the type of role that you all, Greta, you and James, decide for yourselves that you need to support the work is really worth having a deeper discussion with the board about however it is that you imagine it gives you the most leverage to dig deepest into the organization.
Well, I super appreciate the question. I'll just say, happy to report that harkening back to that time, and as you've noted, we had different folks in the role that I am in and in the role that he's in, and I will say you do now have a chief operating officer for whom serving kids and serving families and serving women's and really focusing on those needs are certainly central parts of my professional life, and I'm really excited, and frankly that was part of why I wanted this job, was to really advance some of those missions. And I think we have a number of extraordinary leaders up here on this dais and out in the audience for whom that is a shared mission. And I think the question that you ask is one that we've been thinking about a lot, which is how do we make sure that we have a really robust team in each of the areas that have the opportunity to really move systems towards upstream prevention. I think it's really illustrative of the conversation that we were having earlier on the Pediatric Diagnostic Center item, and Supervisor Arenas, that the connection you made to the conversation on jail reform, which is how do we start really trying to move this big county organization in the direction of upstream prevention, because so many times we're looking at the consequences of really terrible outcomes that were preventable with some early intervention, and trying to strike that right balance between caring for the consequences of failure to make those investments decades ago and serving the people that we have to serve well today who are in adulthood, but being laser focused on trying to create far greater equity and investment in upstream prevention. So definitely those are center focuses as we're asking some of these more structural questions about how do we organize the work, how do we put people in the right positions, and I think some of what Sarah and I have talked deeply about is also the learning she had from serving in that role, and how do we make the use of that position in this office just grow in its capacity and efficacy over time by making those choices well.
And I recognize there's not an answer, like a yes or no answer to the question, because I actually think it's much more structural than just this particular office. And I do just want to say how much I appreciate that you're here. Truly, it means that it matters to the organization, and that matters a lot to me. So thank you. All right, did you have any thoughts?
Sorry, yes I do. I think one of the things that I noticed in this, in the applications, were that there were, most of the applications were from family childcare providers to support construction and operation cost. And, I wouldn't to just hear from you in terms of what we learned about their needs, any like quick highlights in terms of what those were.
So I'll start, and then I'll turn it over to Arcel, because she
Yes, sorry, yes,
she's-
and this is for the grants. So it's
Yeah.
if you could, and I think it's the smaller providers.
Yeah, and Arcel will have maybe some of the numbers more at her fingertips, but the vast majority of applicants, and actually the majority of providers in the county, I think around 75% are small family child care home providers. So one of the really the very positive outcomes of this process was that we were able to create a grant-making process that but we felt very much was in collaboration with the communities and the providers, because we had in some ways the good fortune of watching kind of other government grant applications that were like COVID recovery grant-making processes happen very recently. And so we had a lot of feedback from providers and from the child care kind of community around what was difficult about those processes. And we knew that very logically, one of the biggest issues is that child care providers are small businesses. They don't have administrative staff. They don't have a lot of bandwidth to complete a lot of paperwork and complex government applications. And so what we did was we really tried to provide them with as much support and really listen to what they needed. And what that meant was trying to create an application that was as easy to understand as possible, and then really just be available to answer questions, assist with completing the application. We had a really wonderful team of navigators that supported and in some cases even went out to the homes and sat down and kind of worked with providers. We worked with First Five, with City of San Jose libraries, for example, to make sure that like printing areas were available, just lots of partnership, lots of outreach. And I think we did a survey and got very, very positive results from that. So I think it felt, and we even, there were relationships built with some of the navigating staff where providers would call and ask for status updates and really kind of developed very positive relationships. So I think it was trying to make the process as clear and as user-friendly as possible. And Arcel, do you have anything to add? Because I know you were kind of really doing the day-to-day on this.
Pressing the wrong button. Yes, I think in terms of what we're noticing, in terms of some of the needs from the providers that are receiving grants, is around, especially for the family care providers, there's a high need around safety issues that are being lifted up, and environmental related. We always do an environmental scan, and then we have our partners from the County Office of Ed do an assessment and a review of the space before we finalize the scope of work, or Valley Health rather. But those are some of the opportunities that we're noticing that with this grant money that we have available, that the board allocated, we're able not only to meet some of the recommendations from the providers on how to expand their programs, but also to address some important safety concerns in the home to make it a safer place and a more developmentally appropriate space for children.
Great, thank you. It's just, I know that's like a never-ending need for home child care providers. I'm grateful that we had this opportunity to stabilize those child care providers, especially in my district that we have a bit of a desert out there, right? Folks are really far away, and the majority of people, work outside of South County. They don't necessarily work within their community, and so they really rely on folks outside of their home to care for their children outside of our educational system. The other piece I was wondering about, if there's any opportunity for us to draw down any federal or state funding. I mean, I know the conditions are dire everywhere, but have we learned about any new opportunities to match any of the grants?
Not at this point, but we should be keeping our eyes open for any other opportunities, because as Sarah mentioned earlier, we had close to 500 applications that were submitted. So there's really great opportunity to continue to grow. And these were all applicants that expressed room to grow their businesses, whether it was center, new family care provider, or an established family care provider.
And I'll add to that, Supervisor. I think one of the areas where we may be able to recognize some additional capacity is with the rate reform work that's happening and increasing the subsidy rates for families so that they can be at a higher income level and use vouchers for childcare. So that's an important area where we're advocating, and that will bring more funding into the childcare providers so that they can stay open and maybe expand capacity. Because I think one of the, to Arcel's points, really valuable lessons to this is that existing providers have the capacity to expand and meet the very high need for infant and toddler care if they just had not that much more money. So I'm hoping that a lot of the work that a lot of local advocates have been doing in statewide advocacy efforts have focused on around increasing that subsidy is going to really benefit small family child care home providers that accept subsidies, which was one of the criteria that we had in our grant program.
And let me know how I can stay involved in any of this. I know that we need to make sure that in the IGR policy priorities, this continues to be right at the top. And I'm just going to say this because childcare did not become something that was important to everyone until the pandemic. And then all of a sudden, those who were not maybe the moms in the family also became impacted. And then it became a really important thing that we all needed to take care of, right? And I'm like, oh, well, this is great. And now that we're back to kind of normal times, it falls back in terms of priority. All of a sudden, it's up to the typical person in the family to care for, to figure out how, and to worry about how children are going to fare, right? And how they're going to be cared for. And unfortunately, this sometimes is a gender-based issue, and one that I think that we need to continue to pursue so that we can have some legislative fixes like the ones that you mentioned with a higher reimbursement rate. This is, I worked for First Five. I think you all know this, for about 12 years, and I was a contract specialist at the beginning of my time there. We had a child care grant program from First Five, and I would go out and do site visits. And I mean, there's this iterative process to try to stabilize our child care providers in our cities and in our county. Needs to have some level of permanency in terms of how we do this, right? And I'm excited about the advocacy, and if there's legislative fixes that we need to figure out. I don't want to ask the universe for another pandemic so that everybody sees the value of childcare all of a sudden. But I wish people would remember that so that we could actually facilitate it for everybody else. Anyways, I'll get off of that and just ask you the last question. I know that there was funding for 40 schools for expanded wellness centers, and so what my question there is, how are we coordinating with the school link services efforts to leverage and maximize our resources there?
Yeah, I can answer that. So these behavioral health is the primary department on this, but I know that they're working very closely with the school link services on the development and design of the wellness centers. And I believe that they are going to be bringing back information on the wellness centers in the same report as the school link services report. So I can talk with their leads on that to help highlight kind of how those are connected. Because in the design of it, we definitely talked a lot about leveraging the school link services in terms of how these are designed to make sure that we're maximizing all of the resources, and that the school link services staff are really helping kind of co-design and help make sure that the wellness centers are kind of maximizing all of the county resources on site.
And avoiding duplication, I'm going
Pardon?
to assume. And avoiding duplication, I'm going
That's
to
right.
assume.
Yeah, yeah. So I know that behavioral health is very much looking at that, and they have regular meetings with the cohort of wellness centers to discuss kind of the rollout and design. And so it sounds to me like there's a lot of kind of co-learning as they develop the wellness centers among kind of all of the different grantees, which is exciting.
Just
too.
offline, I'd love to have visits, whether it's the childcare or the wellness centers. I did some in my district, and air hockey, anybody in the one of the wellness centers for our junior highs, which is really amazing, because it's a junior high that continually has struggled, or is in a neighborhood that struggles or chronically deals with all the factors that we know are difficult for families. Anyways, congratulations. Thank you for taking us this far. I know that you're doing 2 jobs. I look forward to seeing you only do 1 job. And then I'll talk offline to see how that one is going to happen, because I think it's really important to have a focus And I know that you know what you've been doing is fabulous, but it is also unfair to expect you to do everything, right? We can just have your kiddos live here. No, I'm kidding. We won't do that to you. All right, that's it for my comments.
So we'll take move approval to receive the report and thank the staff. And you want to second that?
Oh, second. Yes, yeah.
And then we've already taken public comment, so can you roll call us?
Vice Chairperson Arenas.
Yes.
Chairperson Chavez.
Yes, and
Motion
that was
carries.
without direction, but just some questions to staff and follow-up. All right. So we're going to move on to item 7, and this is the Vietnamese American Service Center. And I know we have a brief report on this, and Honey, welcome. Oops. No, I didn't hear it. She was very stealthy. Welcome.
Least counterintuitive microphone interface ever, as we experience at every meeting. Don't worry, honey. The
Right,
clerk can turn
it's-
it on for you too.
It's the gremlins.
Is that on right now?
Yes, you
Okay,
are
thank
on.
you so much. Good afternoon, Supervisor Chavez, Supervisor Arenas, and members of the CSFC committee. For today, I'll be presenting the slides from Attachment A of our status report, which in addition to our usual updates, also contains some insights from our participant feedback survey. We wanted insight into where our clients live, and so we looked at administrative data we collect routinely from our approximately 30,000 customers in the last fiscal year. They come from 33 different zip codes throughout the county. 3/4 of them come from the 10 core zip codes that you see on the map on the slide. And about 1/4 of them reside in the 95111 zip code where the VASC is located. We deployed this survey, the participant feedback survey, for the first time this summer. And the reason is because we wanted to know what's bringing folks to the VASC, and we wanted feedback about what we were doing well and what we could do better to keep drawing folks to our center. So this year we had 374 responses, and we are aware there are some limitations because of the smaller sample size. And as you see, we've already made note of the things we can do differently so that we can engage more folks next time. So of course, improving the survey format, shortening it, making it have less text, and then completing it on site, and then deploying it in different settings perhaps throughout the year. But what I'm really excited about is potentially collaborating with some research evaluation partners so that they can sort of guide us in how to craft questions that would really help make allow us to sort of gauge whether we're meeting our goals. So that's the piece that I'm really excited about. And even with the limitations, I think there are some valuable insights from the survey that I'd like to share in the next few slides. So with this next slide, we observed from our participants that the vast majority of the folks who responded to the survey preferred conversing in their mother tongue. And for me, this underscores the continued critical need for the bilingual and bicultural services we provide at the VAS. And we also valued insights from our participants as to the reasons why they come to the VAS. So my takeaways from these responses was that first, with 60% of the folks coming to the VAS because of the services and the activities there, it was important for us, and it is important for us to sort of constantly gauge what are their emerging interests and emerging needs so that we continue to bring in new programs that address those needs. Folks really appreciate the welcoming atmosphere. So for me, this underscores the importance of maintaining the beautiful aesthetics of the center and maintaining the high level of customer service that our staff provides. And then many of our folks come to the VAS to hang out with their friends or socialize. And so for us, it's maintaining that space and bringing the programs that will allow our community to do that, to come to the VAS to do that. And then with the respondents, we saw that nearly 80% of them visit the VAS at least twice a week. We had a bit more granular data as to the number of folks who came to the VAS 3 or 4 times a week, and that was also significant as well. And again, I think that showed me that for many of our community members, the VAS is like a second home for them. They love to come there and socialize with one another, and it's wonderful to see these familiar faces. For this next slide, we had questions that focus on some key goals that we're trying to accomplish at the VAS. So of course, whether our clients are making new social connections, whether they're learning about a new resource, whether they're connected to a new resource, and then also whether they were maintaining and improving their physical and mental health through their engagement with our VAS services. And across the board, the responses were really positive. For this next slide, we observed that 2/3 of survey respondents heard about VAS's programs through their family and friends. And so that's through the folks that come to the VAS and enjoy and appreciate that experience there, and it passes on through word of mouth. So that was one of the key ways that folks learned about the VAS. And then again, 2/3 of our survey respondents participated in at least 2 different VAS programs and services in the last year. And there were also many of them that participated in 3, 4, 5, and even more services in the last year. And again, I think this is showing me that this one-stop shop model where we're bringing in different services at the VAS is working. So while the data itself was largely positive, I was also very interested, and I thought it was also very important to sort of understand why folks might not have had a good experience at the VAS. And so some of the concerns that they noted, I sort of note here on the slide. And we had our staff follow up with these folks where these participants left their contact information. So first was parking congestion during that peak time, during lunchtime. And we know that this has been a challenging sort of issue since the VAS opened, and it continues because, of course, more than 500 folks come to the VAS daily for our programming. And we've done a number of things to alleviate that congestion. Of course, staggering the meal times for the senior nutrition program, scheduling some of the other programs around those peak hours. And then we've been also trialing different designated patient parkings, types of strategies for the health clinic to make sure that folks that are coming in for those critical services are able to find parking. There was feedback related to the senior nutrition program, and part of it is due to the VAS S&P program being very popular. We have approximately 5,000 folks registered for the VAS S&P program, and then every day we can serve, on average we serve a bit more than 500, right? And so the feedback is that the community wishes we had more capacity to serve more meals at the VAS so that they can get more meals every week. And so, what we have done is, of course, we refer them to nearby S&P sites on those days where they can't get a meal at the VAS. And then, of course, with the volume, there's a wait time when they call in the morning to reserve a meal. So that's something that we're sort of taking note of as well. There's also some feedback about the quality and the texture of the food, which we communicate very frequently and very well with our S&P vendor to just pass along that feedback. There was also some feedback related to just impact on our programming in the evenings due to some temporary operational hours changes that we had when we had a staffing shortage. We've since hired sort of our evening manager, and so we've reopened to those regular hours. So I'll go through the remainder of the slides relatively quickly. But with this next slide, it shows that service engagement went up in the last fiscal year compared to fiscal 23. This slide shows service data for some of our core services for this calendar year. And here we highlight some of that data. On average, VAS ambulatory care provided approximately 500 billable services monthly since January 2024. Again, VAS S&P on average 540 meals daily. And participation in our community programming and services remain really high, approximately 2,800 attendees participating monthly. And then on this slide, just new activities that we've had in October. Highlighting just a few, we had a few workshops just to share with our community an affordable housing opportunity, had a workshop on how to navigate social media and mitigating misinformation and disinformation for the Vietnamese community, as well as a housing clinic in partnership with the Asian Law Alliance. And on this slide, it shows some recent health and wellness programs, highlighting the substance use treatment services support, as well as suicide prevention. And below, we had a series of filmmaking classes and iPad basics for older adults. On this next slide, I wanted to highlight that at the VAS, we're really trying to grow our youth programming. So we're really excited that this last summer we were able to host 2 youth cohorts, first with the Vietnamese American Roundtable's SEAT Civic Engagement Program, and then secondly with ICANN's Y Summer Youth Program. That picture there is of our 3rd floor space, which opened last fall, and it's just so wonderful to see that space being utilized and especially filled with youth. And then on this slide, some ongoing programming that's been engaging for the community. On this slide, just some of the health programming for the community to sort of better manage chronic health conditions, diabetes, and for our older adults, fall prevention programs. Of course, ongoing support groups that we have on this slide, as well as office hours and legal consultation clinics offered in Spanish, Vietnamese, and English. Additional community wellness programs we have for our community, including youth folklorical, morning exercise, karaoke, and so forth. Our staff continues to outreach in the community, and in the last month or so, this slide highlights a few of them. And so, we go to schools, participate in multicultural festivals, and recently we participated in the Binational Health Week at the Mexican Consulate. We continue to have fun community and cultural events at the VAS. We had our Mid-Autumn Moon Festival at the beginning of September, where we hosted nearly 700 attendees and 300 children at the VAS, and it was so fun to see them there. Those pictures on the slide are from the Moon Festival. And in early October, we also hosted our annual Fall Health Fair in partnership with Santa Clara Valley Healthcare. And this year, we married it for the first time with the Vietnamese Caregivers Conference. So it was great just to provide those resources for caregivers. So cultivating partnerships has been one of my priorities. And so, of course, with our co-located departments, that picture you have up there is of our department leadership. So I'm just very grateful for their partnership as we sort of carry out and sort of work together to deliver services to our community. But then also with the community-based organizations and other county agencies that partner with us to deliver services to the community. So we've had regular meetings and engagements with them, and I'm just excited to continue to work with our partners so that we assess what we've accomplished last year and also think about how we can sort of work together moving forward to address emerging needs in our community. And that's all I have. Thank you. I welcome questions from the committee.
Thank you. I'm going to see if there are any comments from the public.
There are no requests to speak.
Thank you. I'm going to begin with the motion to receive the report.
I am going to support that.
Great, thank you. So first of all, this is all great work. I'm glad you've hit the ground running. Hani and the team over there is amazing. I do, I have to be candid with you. One of the things that I was struck by was how little negative feedback we got. And to be honest with you, because whenever I'm there, people stop me right away and give me feedback about all kinds of things. Everything from time, parking, food, you name it. And I know some seniors are happy, just not the ones that interact with me, I guess. But so my hope is that when we're doing these kinds of surveys, that we're a little more focused on things like, and maybe you did this, because I don't think I saw the questions in here. But I think we want to dive deep into access, food, the exercise programs and the types of programs, so that we're asking people what specifically they like and don't like. So that's one request I would make. The second is that I think the creative way you've been staggering programs is important. I also think that at some point we actually have to deal with the parking issue. Now, we did try to deal with the parking issue by purchasing the building that was on the same footprint, but recognizing that that's not, going to be available to us anytime soon. I would like, at the next report, a more detailed strategy for facility access. And I want to recommend that you speak with the housing development that's next to us, because that's a county owned property and, and a county owned facility. And so I'd be interested in that. And I know there's collaboration with our buildings that are on Center Road, but I'm not sure it's quite enough. And then related to that, I'm going to make a recommendation that whoever our VTA board members are next year, that we ask to be included. And this may actually be something, I'll say this to both, Greta and Sylvia, this may be something that we want to speak with the city of San Jose, because they're doing a pilot program for rideshare that may or may not count this area, but if they're already investing in rideshare and we need a certain number of rides either to the facility or to nearby parking, there may be a way to piggyback on a program that already exists that would just allow us to spend relatively little money instead of starting a whole new program. And I would ask Jessica Zank over there. I know she's one of the leaders in the Department of Transportation. I apologize that I can't remember the person working on the program, but Jessica will find them for you. Because it may be something also we want to ask VTA to help fund as part of this other program. So those would be my requests that are included in the motion.
I'm happy to accept those.
Great. Anything from you?
Yeah, I wanted to ask, because I know that there is a lot of growth, by the way, just congratulations on that 2/3 of survey responders saying that they are coming in for social reasons and that they've heard it from friends. I mean, that's just really amazing. And word of mouth is the best, I think, the ultimate compliment, right? I also saw that there were 4 categories for the service engagement, and it was behavioral health, primary care, pharmacy, and laboratory. All of those had, really, they all had growth. The lowest is behavioral health, but that's to be expected. It still had 28% growth, and I think that is absolutely amazing. And so what I wanted to ask is, what are some of the lessons learned that you think you would, that contributed to maybe that growth? Was there a way that you maybe adopted culture or language, or what do you think contributed to that behavioral health growth?
I think in many ways what's been really helpful is that we've had behavioral health peer workers on site at the VASC who, in addition to taking walk-ins and helping our community navigate and understand some of those behavioral health resources, they also run many of our community programs, some of the most popular ones, including karaoke, morning exercise, and citizenship ESL, for example. And so we have these behavioral health staff that's running these programs, and our community is getting to know them on that level, right? And so they built that trust. And so I think then just with that consistency with that staff member, I think it makes it easier to engage them on some of these topics, right? So then and then we've had then after that, behavioral health want to come in, and then host a workshop on suicide prevention or mental health, right? And so we've then been able to use the staff member as sort of a gateway for the community to kind of sit in on this meeting, right? That's one piece of it. And then I think also we've been just really fortunate to have great partnerships with our community-based organizations who've built a lot of great trust with the community and have done a lot of work even before the VAS with trying to reduce the stigma around mental health. And so we try to leverage these partnerships so that these community-based organizations can help us outreach and bringing these folks to these workshops that we have on these topics. So I really credit, I think, our partnership with the Behavioral Health Services Department as well as the community-based organizations that really have really helped us destigmatize mental health with our community.
Got it. Okay, well, thank you so much. I mean, it's looking great. I think you should be really happy with this first survey. I can't imagine as you build more momentum how that's all going to fare out. So congrats.
Thank you, Supervisor Arenas.
So please call the roll.
Vice Chairperson Arenas. Chairperson Chavez.
Yes.
Motion carries.
Jinx, yummy Coke. Okay, thank you. And colleagues, I know we're getting to 4 o'clock. We have 2 more issues. Wait a minute, am I right? Yeah, and then we're going to have our verbal report. So I apologize for those of you who are coming late. We're going to do our best to get through all of these so that our next meeting is more structured. So I think we are on item 8. Thank you.
Hi, Mariel Caballero, Deputy Director, Probation Administration. And with me today is Kim Jocko, who is our Manager of the Research and Evaluation Team at Probation, and Eduardo, whose last name I have forgotten, Eduardo Aceves, who is a Research and Evaluation Specialist with Probation. And Eduardo is going to be doing our presentation today, and we're happy to take questions after the presentation.
Well, good afternoon, supervisors and committee members. Thanks for having us today. In your packet, you have if it were in paper, it would be a thick, comprehensive Juvenile Probation Division data book. And we've also brought a brief slide presentation to walk you through some of the highlights of our service population in the Juvenile Division. Before I turn it over to my associate Eduardo, I just want to remind everybody that in the full report at the bottom of page 1, there is a link and a QR code that will bring you right to the Probation Department's data dashboards. And so I encourage you to peruse those at your convenience. If you're looking through the report and you have some questions about long time ago, those data are available on our public website. And with that, I'm going to turn it over to Eduardo Aceves, our Associate Research and Evaluation Specialist.
Eduardo, it's not on yet.
There we go.
Yeah.
Okay. So we'll briefly cover a few items that are in this slideshow. I know we're time limited, so I'll try to get through it as fast as possible. So here are the topic discussions. So we'll be covering 5-year annual trends, disproportionality and disparity gaps, top 5 arrest and citation categories, arrest geography, juvenile hall detentions, dually involved youth, secure youth treatment facility, and principal service needs. So in this first slide, in 2023, there was a total of 2,190 arrests, which is up 11% from 2022. But it is important to note that while we are trending upwards since our low in 2021, we're still down below pre-pandemic levels. So compared to 2019, we're down 35%. And these trends are similar for referrals to juvenile hall and admissions to juvenile hall. So here we see duplicated arrest versus the unique count of youth arrested in 2023. So this year we saw 100 more youth arrested compared to 2022, which is an increase of 6%. But again, compared to 2019, we're down 29%. So here we're covering disproportionality in 2023. And a couple of items that stick out to us is that the black youth accounted for only 3% of the youth population, but made up 8% of the arrest and 12% of the detentions. For Latinos, the youth accounted for 35% of the population, but made up 69% of arrests and 78% of detentions. So here we're covering the disparity gaps at each decision point relevant to us. So that would be the arrest, the juvenile hall referrals, and detentions at juvenile hall. So we see a pretty large disparity gap when we're looking at arrest between our Black and Latino populations. So Black youth are 7 times more likely to be arrested than white youth, and Latinos are almost 5 times more likely to be arrested than white youth. When it comes down to referrals, Black youth are 2.9 times more likely to be referred to juvenile hall, and Latinos are 2.2 times more likely to be referred to juvenile hall. When it comes to detentions, and this is the area where probation has the most control of, we see similar rates of detention across all ethnic groups. So here we're covering the top 5 arrest and citation subcategories. So petty theft and felony assault and obstruction saw large year-over-year increases. Looking back further, we're starting to notice that they're reaching similar levels to 2019, and this is something that we'll monitor moving forward to see if there's any recurring trends. Here we're highlighting the geography of where the youth live at the time of their arrest. 4 out of the 5 zip codes are located in East and South San Jose. Gilroy made the top 3, and we're starting to see Sunnyvale and Milpitas enter the top 10. So Sunnyvale was ranked number 9, and Milpitas was ranked number 10. So here we're taking a look at juvenile hall detentions. In 2023, 688 youth were referred to juvenile hall, 580 were detained, and 428 were detained until their detention hearing. And so here we're covering the duly involved youth assessment outcomes. So first, in 2023, the probation department reviewed the welfare records of 1,903 youth, and out of these youth, 986, or 52%, had a record indicating some sort of child welfare contact at some point in their past. It's important to note that not all clients with a welfare history are automatically assessed for a DIY placement. With that said, in 2023, there was a total of 50 DIY assessments. 25 or 50% of them were reviews that were requested by JPD. And the results of those assessments, 16 resulted in duly involved determination and 1 as a dual status. 21 became juvenile justice involved. The remaining 5 went to the child welfare system, and 7 were vacated. So that's less than 35% of the assessed youth entered the DIY unit. So here we're covering the secure youth treatment facility. And in 2023, there was 27 youth that were committed to SYTF. 96% were male and 85% were Latino. And here are the offenses and the commitment offenses and the average baseline term of confinement. So 46% of the commitments involved homicide, manslaughter, or the attempted version of that offense. And the offense with the highest average baseline confinement was homicide, manslaughter, and the lowest confinement period belonged to weapons offenses. And so here we're showing the principal service needs for males that were assessed in 2023. So there was 466 assessments completed. Emotional factors was present in 70% of the assessed males. Relationships was present in 56%, and parental supervision was present in 38%. So there was 49 assessments completed for female clients. Emotional factors was present in 82% of the assessed females. Relationships was present in 57%, and family history was present in 35%. And with that, we're open for questions.
Thank you. I'm going to first see if there's any public comment.
We have one request to speak, iPhone 56. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Yes, you know, the number of children that are entering the juvenile justice system, it's alarming. Especially when you consider that more than half have had reports made to the Kank Center. I mean, these are abused children. And, you know, like I told you guys many times, you know, my kids are being sexually abused, and my oldest son, he's reporting being strung out on drugs and being suicidal. And nobody's giving him the help that he needs. Nobody's giving any of my children the help that they need. Who knows what's going on with the other ones? I mean, they're showing signs of sexual abuse. I mean, they have to be suffering. And, I mean, so we're gonna let these kids get raped, and then we're gonna throw them in jail. I mean, that sounds like the perfect thing to do. I mean, you guys are doing a great job, and thank you very much. But, I mean, if we're really gonna make a change here, let's replace Daniel Little. I mean, he's at the head of this. He's the one letting the kids get sexually abused. If he wanted to, right this second, he could make a phone call and get my kids an evaluation. But he is not gonna do it. He's a sadistic man. He's gonna say, throw them in jail. In a few more years, they're gonna be criminals. Let's throw them in jail. I mean, it's terrible what's going on. He needs to go to another place that aligns with his values, not here in this county. I know there are places that they have child brides and they have dancing boys and all that stuff. I mean, he needs to go to a place like that where people are sick, you know? Not in this county, not for our children. Please consider replacing this guy. He's terrible at his job. Thank you for your time.
That concludes our request to speak.
Thank you. I'm going to close the public hearing, and I want to go to start with my colleague, and I saw her leaning in.
Thank you. All right, well, there is so much in this report. But I'm going to start with just noting that there's that increase that you mentioned at the beginning of the conversation. And because of that, I know that the numbers are significantly higher than they were before. And there's a disparity gap at arrest, at referrals, and then all of a sudden in detentions, it looks different, right? So it tells us a story in terms of how others who contribute to the arrest or identify the referral view our youth. And I think it's one area where we need to focus, where, you know, it's either an assumption of guilt, right? It's an assumption of skin. I mean, I think you clearly said Black children or Black youth are 7 times more likely to be arrested, even though they represent 8%, while their population is at 3% in this county, which is really, it just comes to show you that we as a community haven't really moved very far. And our teachers and our counselors and our police officers and our sheriffs and everybody else in between who contributes to that youth getting to that referral and that arrest view our youth differently. And so one of the things that I'd love for us to begin to work on is education about who our youth are and changing that narrative. And I think it's really important for folks to understand in the same way. I worked for drug court within drug court through First Five for a number of years, and these were children 0 through 3 years of age, and a lot of those parents who were in that court system were themselves at one point those children being separated from their parents, right? And so it's chronic cycle that continues to happen, and a lot of the times parents weren't sure what to expect at what age, and so I did a lot of like anticipatory guidance, letting them know, hey, listen, at 6 months, this is what typically happens. At 9, the memory starts getting better, and so they'll start, really clinging on to you, crying at strangers, and sometimes in our cultures we say, well, go and hug this person, or go, and sometimes it is not within what developmentally is happening with that child, right? Or it's not congruent. It doesn't make sense to that kiddo, and so I think it's really important. It was really important for parents to understand so that they could then anticipate, my kiddo is going to begin to be more anxious at this time, is going to expect to want more hugs or more security or more this and that. And it is also true at an older age. We know that our youth want to create their own identity by establishing their community within their own friends and their own peers, and they create that distance from their parents or so from some adults. And while I think there's some basic knowledge about youth in that respect, I don't know that everybody understands that taking risks during our youthful phases is very natural and to be expected. We want them to have those healthy risks, right? And so how do you create that for your youth, for your child, because that's what they're looking for. And if we don't offer those opportunities, they'll create them and will look for them themselves, right? And so I think it's really important for us to begin to change the narrative about what our kids are going through, and especially on top of that, the anxiety and the stress from the pandemic and from isolation, right? And so I'm wondering, what can we do to begin to provide some correct information, some anticipatory guidance for those who are out there who are our partners? And I'm not sure who would answer that, but I'd love to hear some feedback.
Hi, Mariel Caballero with Probation. We did have actually a very similar and robust conversation at the recent Race, Equity, and Justice Systems meeting with our public defender, district attorney, a law enforcement representative about, how we can start to look at these disparity gaps that are happening before kids are coming to probation's door. I think as far as education, I do know that many of the law enforcement agencies have gone through some form of cultural competency training on disparities, but perhaps there's an opportunity to partner better with some of our law enforcement agencies on those issues. This is a topic that I know the probation department spent a lot of time working on in the mid 2010s, early 2020s, through our disproportionate minority confinement work. And so we did spend a lot of time educating folks, but I think that one of the difficulties that probation faces is that there are 15 law enforcement agencies or 13 law enforcement agencies throughout the county. And so everyone kind of does things a little bit differently and has different training requirements. I do believe that there are some state requirements now on racial equity training, but I couldn't speak to what those are specific for law enforcement.
Well, I think first and foremost, we need to figure that piece out, but it goes outside of also race and equity. This is developmental, right? Mm-hmm. And it's one of the things that actually I worked, when we were doing our gender-based efforts, our joint gender-based efforts, the top victims or survivors, of gender-based violence for the city of San Jose were children between the ages of 13 and 16, and then it went, the second group was, I think, 8 through 10, and so, and then it keeps going lower, right?
and so developmentally, some of those children are going to look like they're really hyper because they're stressed out, right? And so a police officer can read that as, well, look at them, they're just bouncing off the walls, happy-go-lucky kids, right? And so nothing wrong here. And so for me, that was really important for our police officers to begin to distinguish and have that level of training. Now, I don't expect them to be, developmental specialists and, oh, that kid is, blah, 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 and put their finger on it. And certainly there's a lot who can relate as a parent, but there's many who aren't, right? Who just are not, that's not their forte. So I think what I'm hoping is that we contribute by having some developmental training for our law enforcement. And we saw on that list of breakdown by capita, which is the zip code that was Ohio's San Martin, Morgan Hill, Gilroy, Campbell, and San Jose. I mean, first of all, I'd love to see some added heat spots there, but we know where some of the activity is happening. We can begin to focus in those law enforcement agencies, and then go down the list. I think it would really be helpful to begin to distinguish some of that. And not just for them, but for our community in general. I think our community in general is being very harsh with our youth in terms of expectations. And they also contribute to how decisions are made within the different corresponding agencies that are responsible for the referrals. I see where we do really well is the disparity gap in detentions, right? And it becomes almost non-existent there for any of the groups, which kudos to all of you for doing that. And then so that means, they're not getting detained, which then for me, this prompts me to ask the question, then how are they getting supported? Because sometimes when they come into our systems, they are then supported with services. And I'm not trying to have our kids stay in detention and become detained, but then that begs the question, there were issues that brought them there to begin with. Then what is it that we do in order to support them if they are not detained? Who is responsible for providing that plethora of services?
If they're not detained, but their case does require to go to court out of custody, the probation department and the probation officer during that time period from when they're released to when they come back to court would be working with the family to identify safety plans, potential disposition options, maybe service provision. That would all go as part of the court decision about whether or not the case is how the case is adjudicated. So there is work that's happening once a youth is brought to detention and then released. Before their detention hearing, there's a wide variety of activities that occur with probation.
Once again, graphic would be great, so I can understand where, what the process is. Sure. And then second, I want you to delineate between these numbers of, because I think it was 896 or 986 of the dually involved youth, and I think you heard me mention that in a previous item, that were dually involved, yet there were only, what was the number, a really low number that the dually involved assessment outcomes. I think we had one requested by DFCS. There were the lawyers who requested it, I'm not sure who's JPD.
That's juvenile probation.
Juvenile probation requested 25, and this is out of 986 dually involved youth. Now, I understand not all of them are going to qualify, right? But why is that why is that so low?
So one of the things, and I actually just sent a message to Kim because I realized that this is duplicated numbers, and so we did not provide you with the unduplicated number of the 986, how many is unduplicated. So we will do that in future presentations, and we'll also probably revise this report before it goes onto the website to have that information included. So this
Unduplicated for what system?
Unduplicated in probation. So of the 986 where a child welfare record was found, this was if a youth came in multiple times, they would be counted multiple times and reviewed multiple times. So this was the total number of referrals that came to the department, not the unduplicated number of youth. So it's not 986 youth where a child welfare record was found. It's 986 referrals to the department, so arrests or citations. And I apologize that I didn't catch that until right now.
Those are still red flags, right? That's the same child coming into the system multiple times.
Yes, of course.
That alone right there would, for me,
be a
trigger a dually involved youth assessment.
So the second piece of that is that these are young people who have had a child welfare contact at any point in their lifetime. It's not someone who has an active case right now.
I understand that. That's a regardless. That's his history.
So then agreed. And so then for why the dually involved youth, the number of 50 kids who were assessed, those are the young people that have either an active case in DFCS or an active case in probation, or have come through and the probation officers are identifying that there is some concern, that they want further assessments done. And so then a 241.1 is requested that is done jointly by probation and DFCS.
Okay, I'm going to accept this report, and I'm going to ask in my motion to have a breakdown of the dually involved youth program with for you to delineate those differences and the discrepancies between the numbers. And the actual outcomes for the program. What I'm looking for, Mariel, is I'm looking for what are we doing for these kids, and this is anecdotal. Even before I came in as a supervisor, I would hear from the unions. How I should appreciate, how I should look at the cases of the kids who are in probation, who were also involved in DFCS. It's not a surprise, right? We know that. Unfortunately, we recognize that there are cycles that happen. And so if there are cycles that happen, what is it that we're doing in order to make sure that we're working upstream with these kids? And not having them come into our system in some ways is on parallel with what DFCS is also, I think, the misstep that had happened in not in having the lowest removal rate in the state, because then those kids don't become part of a system that offers supports, right? They just don't. And also we are creating risk for those children. And so in that, I know that there's a whole effort in order to not criminalize our children, and I don't want to criminalize our children, but if we are not having them be part of and I don't want them to be detained, but what are those systems that are really holding them? They're coming back, they're repeats. I mean, you just finished telling me 986 are duplicative. I don't know what that base number looks like, but I would venture to say that, at least twice, maybe 3 times. I don't know what that number is, but this, to me, is a cry for help for our youth. And so we're at the end of the road here with probation. I don't want them to go any further than probation, right? I know you don't want them to go any further than probation. And so my question is, what is the system that is going to capture them? For me, one area that could really work would be the dually involved youth program, which I think is really, really low. And I'm going to venture to say that it was really low because we didn't have a lot of children who came into our system because we didn't remove them. So there were very many to pick from to begin with, right? Because you need to have an active case, is what I heard you say earlier.
Yes, in order to be served by the dually involved youth unit that is both social workers and probations working together, you have to have an active case in both child welfare, a 300 case, and an active case in probation, a 602, which means you have to be an official ward of the court. And the vast majority of clients that probation serves are not official wards of the court. We serve them informally. And so that's where they're being served in other places within our department, whether it's in a JSU, in our prevention and early intervention unit. And so I think the deeper work that we have not yet done on these numbers is to see what happens to the rest of those kids and where they are then distributed throughout the rest of the department so that we can describe what types of services those are. And we can do that type of analysis and bring that back to this committee. So if you're looking at the figure number 28 on page 15, just to give you a little bit of an example of what's happening is that the 17 youth, the dual status and dually involved youth, are being served jointly. The 21 juvenile justice youth means that they have a 602 wardship case, so they have been officially adjudicated by the juvenile justice court. For child welfare, I believe that means that they have the 5 youth there. The court found that they would be better served by the child welfare system, and then 7 cases where the petitions on both sides were dismissed, so there wasn't a vehicle for probation or DFCS to serve them. And so that's what happened to those 50 cases that came in 2023. There was also a group of kids who had come in prior that were still being served by the DIY unit. And I think all of these questions are really great that we can then do more refinement for what to share with you in the future.
Great. I appreciate that. I also would like to, I know that there's another issue that I've brought up regarding some of our youth being categorized as runaways rather than being reported. They just need to be recognized differently within our system so that we can serve them differently. I'm looking for what is happening within our system that we need to create changes around. And I am at a point where I know that we are doing a disservice to our Latino boys because I see where they end up, and that's in our jails. So what is it? And I'll just challenge everybody in this room to help me figure that piece out, because what I need is for us to figure out systemically. Our system is doing the best that it can in terms of how we are responding. Obviously, we're mitigating for some of what everybody else is bringing these kids into the system in terms of referrals, and unfortunately, race has something to do with it. We're helping mitigate for some of that, but then what else are we doing for those children who are both in both of those systems, and how are we also connecting with their support systems in their community because they don't have a case with us? Because we just kind of let them go, right? And then we hope that the school system, which I know that's not happening, isn't supporting them, or a community-based organization is supporting them. Somebody's supporting them. I don't know who. And those are the questions that I am really uncomfortable with. So I'd like for us to have a further breakdown of the dually involved youth assessment outcomes as part of my motion, as well as to have an offline conversation about system changes for our brown and black youth that are overrepresented in our juvenile justice system.
I'll make a second to that motion. It's to receive the report and then get a further breakdown of the the dually involved youth. And then the second part of that was to have staff meet with you to discuss strategies to address children of color ending up in the system in the first place. Is
Right.
that accurate?
And,
All right.
and what we're doing when they end up in the system. Yeah.
And then service provision when they're in the system. So I'll second that, and
I'm so sorry. And is this cross-reference over to the full board?
that's a great question. Does this go to the full board, this report?
It has at times in the past when it's been asked for, but it doesn't generally.
I would like for it to be cross-referenced to the full board and in coordination with the Community Violence Prevention Plan item.
So I would support that, but I want to affirm that it's going to be in coordination with that, because so just two things I was going to raise. One, I wanted to say how much I appreciate the report, and I do think you all as a department have over and over again been extremely transparent with numbers, and I think that's really critical. I do think that, I had a chance to read this, and I do think one area that I want to recommend some consideration be made, and perhaps this is when this gets attached to the violence prevention strategies, is this. It is very difficult with these kinds of topics to do analysis that help us understand not just the implication, but the inputs and the outputs of the numbers. And you are one piece of the system. So I just want to acknowledge that all of us are just pieces. When this comes to the board, I think it is incredibly important to be able to name the partner organizations more concretely so that it is easier to understand how children get in and how children get out. So that's one issue I just want to make sure is highlighted in the report back to the board. The second recommendation I want to make is that, as I was listening to this discussion, I was really struck by there are many core questions that we're trying to always get to, which is how are we heading children off in the first place? That all said, sometimes we put rules in place that address how we program certain children, and sometimes the rules are state or federal. For the dually involved youth, I think it is very important before this comes back to this committee or to the board to better understand what are federal laws, what are state laws, and what are rules we're putting in place ourselves. And we're going to talk about this subject in another item, but when we were creating one of our youth programs, our Intern and Earn program, we aligned our rules about who could access the program based on federal and state guidelines initially. And the reason we were creating Intern and Earn is the federal guidelines and state guidelines weren't allowing us to provide support to children who were no longer in foster care. So they had to have some foot in the grave in order for us to help them. But we were using all general fund dollars. It was completely unnecessary for us to do that to ourselves. So I just want to make sure as we're thinking these problems through that we're not imposing rules and regulations on ourselves that impede our ability to provide support to children of any age, truly, but really our kids as we're speaking of them today. Can those be included in the motion?
Would love for that.
Okay.
Yes, thank
So we have
you.
a motion and a second, and I'm going to recommend that, and we've already taken public comment, and is the motion clear?
Yeah, I was just going to clarify on timing. I hear the request to bring this back as part of the community violence prevention. I will just also say I know there was a desire to clarify some of the stats and figures in the report based on the deduplication effort. So the version of the report that we bring back will also make sure we have sufficient time to get that addressed. And my question was, there was some additional analysis that was requested by Supervisor Arenas, whether you wanted that to come back to this committee or to be embedded in what we bring
I
to the
think
full
the
board.
first request that she made, and I just want to verify this, is I think this is going to require a little bit of discussion directly with you. And how I interpreted what this discussion was being able to have a bigger discussion about how we were addressing young people in our system. And what I understood was that would really be offline, a deeper discussion, because I think it will help shape future discussions.
Perfect, thank you.
Did I hear that correctly?
Thank you.
Okay, good. All right. So we have a motion and a second.
Vice Chairperson Arenas.
Yes.
And Chairperson Chavez.
I almost said second. Yes, all right. And colleagues, I do recognize the hour is late, and we have a few more items, and I'm just going to confirm that I'm correct. We have item 10 and item, am I right? We have 11 and 10 and 11, is that accurate? And then 16, is that correct?
I think you also have 15.
Oh, I'm sorry. Thank you. 10, 11, 15, and 16. So we're not going to have any reports, so we're just going to pepper you with questions. Okay, go ahead and introduce yourself. Welcome.
Good afternoon, George Montes with the Office of Contracts Management from the Social Services Agency, and it's my pleasure to respond to questions.
Excellent. Thank you. Did you have some on this?
I sure did.
Okay, go ahead.
Okay, so there's a number of issues that I found regarding, oh yeah, of course, regarding the contracts and who's getting them, particularly in the intergovernment agreement service category, which has grown from 18.3 million back in 2018 to now current 62.7 million. And so there wasn't any information provided about which services that are included here. There wasn't info provided about which departments are being funded by the contracts. They appear to be non-competitive, which may make sense because they're going to some cities and school districts, but that all means that they should be easily reviewed and understood. The performance info is not readily available. It's unclear if the grantees are serving most critical population grant designed to serve, and there is no information on most contracts in terms of over or under utilization. I we're getting to the brass tacks here. Didn't start up with any of thank yous. I'm grateful for the report. It just left me with a lot more questions about just the enormity of the amount of money that is going out to our service providers and how we are keeping track about the really important work here. And so I don't know if you have any feedback so far on some of the items that I made mention of.
Sure. Thank you, Supervisor Arenas. Those are really important questions and relevant questions. We do have data to drill down further on the types of contracts with each category, including interagency agreements. And the interagency agreements are exempt under the Chapter 5 policy currently. Simply, they are agreements that are between like county departments, the Social Services Agency, the Juvenile Probation Department, Behavioral Health, and there is an exchange of either services or funds to either serve populations or add money to other resources that are needed across the county. We can give you that detail upon your request if that is something that you would want us to report on.
Yes, and I'm going to give this to the clerk so that he can hand it to you. So I have a really long motion to make on this, and so in order to avoid just reading the whole thing, I have provided a copy of it to you all for some ease there. So this is to return to CSFC in early 2025 with supplemental information. And then here you have a list of items that I'd like for you to return with from A to G. And item number 2 is to return quarterly to
CFSF with updates related to SSA, RFPs, reviews of existing contracts, and highlights of utilization challenges and other emergent issues. Come back and do this on a quarterly basis and have a deeper dive from 1 to 3 of the 7 county departments with SSA contracts so that each department is included in a quarterly report and have a deep dive. It's really, it doesn't allow us to do our deep dive when we have this annual report, and then it's, you know, a half hour before we're over time now. And so for us to really appreciate how money is being spent, invested, distributed, and if we are trying to figure out how these ways are the best ways to invest in our community. This committee has that responsibility of doing that. Lastly, number 3 is refer to the Board of Supervisors a request for CSFC for the full board to agendize the study session in 2025 regarding SSA contracts and board policy options. And I thought it would be most important for us to do that as we're getting new members on board, and for us to understand in a very deep level how our contracts are faring, how they're doing, how this is all working. And I apologize, Chair, for doing this at the last hour, but I think it's really important for us to figure out how our contracts, like I said earlier, are faring, to have a real breakdown of what that means. And, you know, earlier I noted that back in 2018, we had $18 million that were being distributed through intergovernment agreements, but now we're at 62 million. And so, you know, that is a lot of money that we are investing, and we need to figure out whether that's the best way to invest money, especially when we're having cuts in every year for the next number of years.
So let me ask a kind of a broad question, and then better understand the motion. And let me just say thank you for writing it out. If you had read this, I would have lost it. So one request and recommendation I would ask if you would consider is that I think there is a lot of value in having a discussion specifically about the policies that we use to determine when, you know, for example, when something's interagency, when it isn't, all of that, I think is really critical. The one request I would make is that I think and staff, you should tell me what you think about this too. I think there's a lot of value in having that dry run first come to committee and then determine what pieces of it go to the full board, only because there are going to be some issues that you're going to pull out and say, I want to prioritize these 3 issues in addition to having an educational session with the board, because I do think there are parts of we have really significant partnerships that are external, both in the private sector and public sector, from my perspective, that also would benefit from the you know, kind of a deeper understanding of what are the critical policies that we do and don't have before us, or tools that are necessary. So it's almost like a dry run. It would allow you to refine it and then give the board feedback on.
Perfect, and
Okay.
it is actually 1C out of the 1A through
Plan
G.
for revising
It's the plan for revising future.
Oh, yeah, and
reports
that
to-
might be a way to address that. So that would be one recommendation. The second recommendation I would make, and I think that, George, this is something that I know you and I have talked about, and that is the question about how we structure contracts with partner agencies to give them the maximum flexibility to be effective, and doing that in a way that is protective of our fiduciary responsibility. So let me share what I mean by that. Some years ago, when we were trying to restructure the DV programming and how we were partnering around domestic violence, one of the issues that came up is that a lot of the agencies that were providing support to the victims were in this tough place because they were getting some money to deal with mental health in their agencies, some money to deal with like housing for domestic violence folks, some money to actually pass through to victims. And they could have 3 contracts with us to deal with a single population. So one thing that I had asked George and his team to consider is where we have nonprofits that have very strong back of house, how do we continue to reshape the contracts so it allows for maximum effectiveness without, and maintaining strong fiduciary oversight in a way that didn't waste money and have to have 3 contracts where you could have 1. Now, I know there's been a lot of work done in that area through the Office of Gender-Based Violence. I think if there are any improvements that have been made in this area, and I'm looking down at you because I know this is part of your shop too, I think that would be really important for the board to understand, because what I worry about is that we do not have, that a lot of our contracts end up being, components of them end up being pro forma because there aren't that many people negotiating contracts. And because of that, we're not able to dive in deep and be as outcome driven, because I think we're managing a lot versus being able to drive a lot. So I think that's a fair point to raise with the board. And I also think taking a look at where you have these more mature relationships with nonprofits that we've been in business with, and we've audited them, where do we have flexibility to continue to turn the dial to make sure that we have really effective outcomes for the clients that we have, instead of, frankly, making nonprofits or businesses creating conditions that they would have to lie to us to say, oh yeah, we did what you wanted, but we did it better and we're not telling you, or we did it worse and we're not telling you. And we really want a relationship where people come and say, this doesn't work, the contract structure doesn't work, here's what we'd like. So I say that not to put more into this, because I think it's already very compelling, but more, Supervisor Arenas, for something, if you wouldn't mind keeping a lookout for it, because I think there is an opportunity for us to really improve services to the people that we're serving and have less overall contracts, save money, but still be more effective. So that's really what I hope is an underpinning of this. Is that comfortable for you? Just, again, not direction, but more
Right.
feedback.
No. I absolutely agree with that. I think, the recommended action, and this is what I was, going over in terms of there was not enough information regarding the contracts and what they were doing and who they were, their performance, and unclear who were the grantees. And I think that's information that we need to know. But and in order for us to determine whether those contracts are effective, we need to first have that first set of information, and then also ask that question to our CBOs or nonprofits, or these are non-governmental intergovernment agreements. Are we effective as we can be? And also, some of these processes, each agency has their own difficulties in terms of contracts. And so if we can reduce that level of bureaucracy, I'm all for it. Absolutely.
And then just one other thing, now this isn't going to make you happy, but let me just say this out loud. These reports are much clearer than when I started. And I more say that because I'm going to say go girl, because these really are, and they're more descriptive, and they're much clearer. And I concur with a lot of the concerns raised by my colleague, because I know it's a trajectory, and I think you're going to see it home. So there you go. All right, we have a motion and a second. And do we take public comment? I apologize.
No.
There are no requests to speak.
Okay, I'm going to close the public comment, and we're now going to vote.
Vice Chairperson Arenas.
Yes, and so the motion is to
Take your document,
recommended
have
action.
it come back here
Have it come back.
first, and then look for opportunities for streamlining and improvement.
Perfect. Yes.
Thank you.
Chairperson Chavez.
Yes.
Motion carries.
Thank you. Now we are on to item 11, And this was the Deb's report many hours ago, I know, when we started here. Did you have questions on this one? Deb's? Okay, so this one, I just had a couple things that I wanted to raise with the staff. And first to say, we don't need a presentation, and I'm very sorry we made you wait all this time to not be able to do one. But I did want to say that I thought the report was very well done and had a lot of really good information in it. There are two issues that I would like to ask for a future meeting to consider. And Sylvia, I'm going to look to you, because if you say, no, I'm not interested, that would be important for me to know. But here's kind of first, let me let you introduce yourselves. I'm sorry.
Good afternoon, Ilona Betkoye-Gevergis, Acting Director for DEBS. And with me, I have Anita Torres, our Senior Management Analyst.
Great, welcome both of you. The thing that I was most interested in is really understanding if it's possible for us to do a much deeper dive into how we support people being able to sign up for EBT or other programs. And here's the challenge I want to give you. I want to receive the report, and I want to ask staff to go out and talk to people who are not currently accessing EBT. I have a few high schools I'd like you to go to and talk to the parents there. I had the most illuminating conversation with very low-income families, all of them food insecure, none of them who use EBT. I would say easy half of them could. They gave me a lot of ideas about why they do not fill out these documents and why they're nervous about it. And part of it would be what you'd expect, mixed status families. But there are other parts of it relative to a belief that they have about whether or not they're eligible for a lot of our programs. When I ask them the number one reason they don't engage with us, the number one reason is that we were confusing, and it was easier for them to go to Second Harvest Food Bank or other institutions. And the problem for us with that is that those organizations are so stretched for resources right now, they need funding from us too. If those families would be able to be served by this other program that does not cost us our general fund and allows us to use that money creatively to support families in other ways, I'm really excited about it. So my motion is to receive the report, to say thank you and congratulations on your interim role, and to please go interview families who are not using our services today and come up with a couple of pilot strategies that demonstrate our ability to get them signed up and access to resources, but focus particularly on food. And that would be my motion.
I'm going to second that. I'm just going to have a quick, in the spirit of just making it really quick, I like that you're asking for some of those pilots. I'm also interested in any concentrated efforts for enrollment targeting South County individuals. As you well know, that I've asked multiple times from the dais for us to continue to enroll folks who are undocumented, who now can. And I don't know what those efforts are, since we have quite a bit of Hispanic or Latinos who are in our Medi-Cal system. I just want to, I think these are folks who are still not being supported in the way that they could. So I don't know if there's an answer.
South County?
So if we could include South County, that would be great.
We'll do that. And I'm going to ask for her to send you some contact information, and I'll do the same.
That would be awesome. Thank you.
Thank you.
The question is, I think what you said, that you'll send us the contacts for the schools.
Yes, because I would love you to talk to these folks. It was very illuminating. Thank you.
Yes, and for South County, we're connected with the CBOs there, but I would love any additional contacts you can provide that we can connect with.
So
that would be great. All right. So we have a motion from me, a second, and with the inclusion of South County, and we'll make sure we get you contact information.
Oh,
Just a reminder about public comment.
Thank you. Do we have any public comment?
There are no requests to speak.
Thank you. We'll close the public comment. We will now take a vote.
Vice Chairperson Arenas.
Yes.
Chairperson Chavez.
Yes.
Motion carries.
Thank you. Am I correct? We're on item 15. Michaela, you've been tracking me.
Yes,
Are we?
you're-
Okay.
yeah, item 15.
Thank you so, so much. And I really do want to thank my colleagues. I know the hour is late, and I really appreciate your attentiveness and your time. And welcome to the legislative team.
Good afternoon, Chair Chavez, Vice Chair Arenas, David Campos, Deputy County Executive, and we have our IGR and County Council team, and I'll just have each of them introduce themselves.
Good afternoon, Elaine Trin with IGR.
Good afternoon, Mary Hannah Weir, Lead Deputy County Counsel.
Good afternoon, Erin Evans Fudum, Legislative Deputy County Counsel.
Good afternoon, Monica Chong, Intergovernmental Relations.
If I may, we have presented already and just take any questions. I think both of you have heard the presentation. It's
Oh, you have two in another committee?
in
Hewlett. Okay, great.
Hewlett, yes.
So I'm going to turn to you for comments and questions because I did know you asked about this particular issue relative to this committee.
I did, and there is maybe what I could do is give you some feedback offline because I can. It's 4:55, and I want to be respectful of everybody's time. I know that there's another opportunity for us to kind of get into it at the board of supervisors, and so I can offer a memo there as well.
Wonderful.
If that's
Sure.
fair, you know.
Yeah, that would be great. So just if I could, this is more reflecting a discussion we had earlier. First, I do want to thank you for the much deeper outreach and into all of our different parts of the organization. I am, for this committee, very interested in making sure that as part of the outreach that we're doing in the future, if we can, I think areas that the board has already raised a lot of concern or issues about, that we should have some mechanism for coming back to committee to have discussions about particular topics. And I'm mostly thinking about, I don't want to, because we're in a Brown Act, I can't talk about the issue I want to talk about. We'll talk about it at the board. But I do think that being able to kind of reach back to committees where there's something, again, that's got just a high level of interest might be of benefit to all of you as you're thinking about how to shape policy that you're interested in or that the staff is interested in.
Through the chair, happy to do that, and of course happy to get your input on specific changes to the language. And this is a document that has gone through the committee meetings and has become better because of those comments. So we welcome.
It's great. It's so
the
much
specific
better.
Comments,
Yeah. So, and I will just add one for myself, which is I put the Second Harvest Food Bank and supported putting it on consent, but I am really looking to the state to play a greater leadership role in helping us fund food. It's a basic necessity, and I know you have a lot on your plate, but that's just something I'm going to really lift up because it's going to be the general fund, it'll be EBT, or it's going to have to be help from the state because the need is dramatic in the community. So with that, I don't think we need any action there except to receive the report and to say, look for money for food.
Second.
All right, we have a motion and a second. Any public comment?
There are no requests to speak.
I'm going to close the public comment, and I'm going to ask for a vote.
Vice Chairperson Arenas.
Yes.
And Chairperson Chavez.
Yes.
Motion carries.
Thank you all.
Thank
Truly.
you.
Great work. All right, we're going to item 16, and I'm going to look over and say, team, what's happening?
Hey, good afternoon, Supervisors. Daniel Little, SSA Director. Just a couple things. The Veterans Service Office is planning our annual Veterans Day celebration. So when we get more information, we'll pass it out to your offices. And then earlier this month, our Senior Nutrition Program celebrated its 50th anniversary. It was a great way to appreciate the work of over 37 community organizations that provide more than 1.5 million meals to 16,000 older adults each year. With that, happy to answer any questions.
Any questions? No. Thank you.
Thank you very much. Ignacio Guerrero, Director for the Department of Child Support Services. I just wanted to quickly report out on a couple of data points for the end of the federal fiscal year, which is what we use in child support. through the federal government for reporting. As of September 30th, the end of the federal fiscal year, our caseload was 24,500, serving over 30,000 children this past federal fiscal year, and collections of $83.4 million. We ended the federal fiscal year ranked 19th in overall performance out of 52 county child support agencies in California. That's a ranking which is an aggregate of 4 federal performance measures. Santa Clara County is still the highest ranked, largest caseload county in California for the federal fiscal year ending September 30th. One last piece to mention, one of the measures we're also evaluated on is cost effectiveness. Our cost effectiveness ratio was $2.80 for the end of the federal fiscal year. What that means is for every dollar in funding, we collect $2.80 in child support. Counties are required to be above a $2 minimum in cost effectiveness, and Santa Clara County is well above that. It's actually one of the highest cost effectiveness figures we've had in a long time. So, and then one last point to mention in terms of a highlight, our percent of cases with back due child support payments. We benchmarked that against state averages. Santa Clara came in at 68.3% for the end of the federal fiscal year. That's against 62.7% for the state average, so we're doing much better. We're ranked 7th in California out of 52 counties, and we are 1st in terms of the 10 large caseload counties in California. So that concludes my report.
Congratulations, Ignacio, to you and your entire team.
Thank you.
You move the dial every single year. Thank you.
Good afternoon again. Mariel Caballero, Deputy Director, Probation Administration. I'm just going to highlight a couple of prevention-oriented activities that the Neighborhood Safety Unit sponsored or supported. In Gilroy, we do a twice-monthly food distribution with Second Harvest Silicon Valley. We had a loteria night. Every Thursday and Saturday, there is futsal and volleyball happening at Cesar Chavez Gym. They had a monthly cafecito with the Gilroy Police Department, and they also discussed upcoming health and wellness workshops. They watched Coco, a movie night in San Ysidro Park, and tomorrow night is Spooky Night, where community will have resource tables, activities, contests, and a haunted house. We also, in Gilroy, partner with Public Health, DFCS, SSA, the District Attorney's Office, the Reentry Resource Center, and a variety of other folks. In East San Jose, we are doing this, we have homework club every Monday. A food distribution once a month with Second Harvest Food Bank. The Parent Project launched earlier in September with the District Attorney's Office, so we have a 10-week series going on now. Every Friday there are fitness classes, and Catholic Charities, through a contract with probation, is doing a twice-monthly youth group for youth who live in and around Valley Palms, and that's just a quick highlight. Starting next month, we'll start sending you the monthly calendars to your offices.
Oh, that's great. That'll be really good.
Okay, thank you. I actually don't have any, I think I covered most of my updates in item number 6, but I will say that starting next month, we'll have the fully new seated group of Youth Task Force commissioners. So we're excited to get that work started with, I think, about 7 new commissioners on board. So that's been exciting. We're very grateful for all of the board offices for getting all of the nominations and oaths done in the last couple of months. It's been a lot of back and forth and lots of support. So we're very excited to have all of our new commissioners on board.
Very excited. They were so helpful with the fentanyl task force. I can't even tell you. Young people are so direct and honest and amazing. So with that.
We do have a request to speak.
Oh, please. Thank you.
iPhone 56, you'll have 2 minutes to speak. The timer will start when you begin speaking.
Yes, I mean, I was disappointed that Daniel Little didn't mention anything in his report about the recent reporting of the child who died, Jordan Walker. I mean, it was due to the county's negligence, and I mean, every time there's a death, he completely ignores it, and he gives a big presentation about how great a job he's doing. And I'd just like to ask him, would you be willing to resign for the good of the county? I mean, just think about Daniel Little. Just think how many kids would grow up and be happy and have a bright future if you were somewhere else. I mean, we could put somebody else. It would be a great sacrifice on your part, I admit it, but we could put somebody else who really cares about children, who, when they hear that a child is being raped, they run to the phone and they call and they get a screening done. They don't talk to Valerie Houghton. They don't talk to Judge Chowry. I mean, I know how it all works, and I know, I mean, I can't prove it, but it seems like every time I ask you for a screening, you act like it's coming out of your own pocket. I mean, it only makes sense that it's working that way. I mean, it's just, you're not fit to be in social services. Please, make this sacrifice. Please, just resign. We already had 3 deaths in a 1-year period, probably more. So some stuff doesn't just, it doesn't get reported. And so many kids being raped. I mean, please, just resign. Let's go somewhere else, or go to Roads and Bridges. Go to that department. I mean, you could do a great job there. Yeah. Well, I hope to hear that you're going to resign. Thank you for your time.
That concludes our request to speak.
Thank you. We are adjourned, and our next meeting is in December or November? Anyway, I will not be here for the next meeting, but I will say we have a meeting coming up, at least 2 before the end of the year. So thank you all very much. Appreciate you.